ज्येष्ठराजं ब्रह्मणां ब्रह्मणस्पद आनश्वन्नोतिभिस्सीदसादनम् महागणपतये नमः। ॐ प्रणो देवी सरस्वती वाजे बिर्वाजनीवती दीनामवित्रवतु आनो दिवो बृहदत्पर्वदाता सरस्वती यजतागन्तु यज्ञम् वाग्देव्यै नमः। ॐ भद्रं कर्णेभिः शृणुयामदेवाः भद्रं पश्येमाक्षभिर्यजत्राः स्थिरैरङ्गैः सुष्ठुवागुंसस्तनूभिः व्यशेम देवहितैर्यदायुः। स्वस्ति न इन्द्रो वृद्धश्रवाः स्वस्ति न पूषा विश्ववेदाः स्वस्ति नस्ताक्षो वरिष्ठनेमिः स्वस्ति नो बृहस्पतिर्ददातु। ॐ नमामि धन्वन्तरि आर्यदेवं सुरासुरैर्वन्दितपादपद्मं लोकैर्जरारुग्भयं मृत्युनाशनं दातारमीशां विविधौषधीनां धन्वन्तरि रमानाथं सर्वरोगनिवारकम् आयुर्वेदप्रवर्तारं वन्दे पीयूषदायकम्। सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। ॐ शान्ति शान्ति शान्तिः।
दशभूपः समवापि दशवापि समोरुद दशहृदयः समापुत्रो दशपुत्रो समो द्रुमः। 10 wells are equal to a pond, 10 ponds are equal to a lake, 10 lakes are equal to a sun, and 10 suns are equal to a tree. Thank you. Now I call AJAYAN SIR from second profession BAMS for welcome speech.
A very good afternoon to everyone. It gives me an immense pleasure to welcome our chief guest, Dr. AJAYAN SIR. I welcome you, sir. I would like to welcome our beloved principal, Dr. C.T. Basavarajaka, sir. Next, I would like to welcome Dean of our college, Dr. Lakshmi Narayan, sir. I would like to welcome Dr. Niranjan, sir, HOD Department of DRAVYA GUNA. I extend a warm welcome to all the teaching and non-teaching staff and the students who have gathered here. Hope this event enriches our knowledge and appreciation for the gift of medicinal plants. Thank you.
Thank you, Anju. Now I call Soumya from second profession BAMS to introduce our chief guest.
Good afternoon, everyone. We all are honored this afternoon by the presence of the Honorable Chief Guest, Professor Shri Dr. AJAYAN Sir. He has done MD and PhD in the Department of DRAVYA GUNA. He is the President Center of Indian Medical Heritage, Kanjikode, Palakkad. He belonged to traditional background family in the field of Agatsamarma Shastra, born and brought up in a lineage of Agatsamarma practicing family, trained and studied under Gurukulam way by various gurus. He has demonstrated history to treating spine and neurological disorders, sport injury care. He has teaching experience of about 19 years in various Ayurveda colleges recognized by Ayush. Member faculty, member on setting up of National Network on Documentation of Local Health Tradition and Ethno-Medical Practice. Member Central Council for Research in Ayurveda Science, Ministry of Ayush, Government of India for Research and Documentation of Marma Chikitsa. Former Member Board of Studies, MGR University of Health Science, Gindi, Chennai. Member Institutional Ethics Committee, AVP Research Foundation, Coimbatore. And his contributions are plant conservation, propagation, cultivation, plan and suggestion, contributor, and constituted botanical gardens on different Ayurveda colleges. Ethno Medico Botanical Survey on various states of India, Andhra Pradesh, Telangana, Tamil Nadu, Maharashtra, Karnataka. He is a field of expertise. Ayurveda Ethno Medico Botanical Information, Collection, Documentation and Research and Extra Pharmacopoeia Drugs Study in Ayurveda. Field Survey Expert on Western and Eastern Ghats of Peninsular India. Agastya Marma Shastra Teacher and Practitioner. He is also involved in Training to Teacher program by Central Council for India Medicine. Thank you.
Thank you, Soumya. Now I would like to welcome our chief guest to share the knowledge about the DRAVYA SAMIKSHA 2.2.
Good evening, everybody. It's a great honor and a pleasure to me to here standing here second time. So this is the second year I am coming here, and what the arrangements, love, affections, and all shown by all of you is a great thing to me, and I think that I am able to share some of the important information in last day and today also, and we are now going to see some of the important things that is very essential in clinical practices. Nowadays you are seeing that their medicines are very costly, it's becoming costly, and some of the medicines are not getting. And this will keep away the publics from us. So when the industries become big, so like the companies become big, they are producing medicines aiming only to get the profit from that. So most of the time we are trapping in that space. That make a barrier with the society and the doctors. So one big medicine, if it is cost more than 300 rupees like that, then the doctor, the normal person can't able to afford this. Because we know that in India, the main population is a middle class and a very poor class, they are struggling for their lives, especially in the villages there. So that's why it's our duty to select some of the important plants that are very essential in clinical practice, and that should be kept in your clinic so that you can use the multi-levels. This was noted by our areas also. That's why they found that some of the easily available drugs, so which will be very commonly available drugs and can be very effective to our diseases, and it will be cheaply available in the surroundings and can convert it into numerous formulations. So when we are studying the DRAVYA quality also, so like that quality is there. So such drugs they are selected for the purpose. That's you can see in this AGROUSHADA. So this presentation is aiming to get an idea about what are the essential drugs that you have to keep in mind and you have to keep in the clinic so that it can be utilized in a very small amount to the patient, but its potency is very high and what the result you are getting is also very high. So we are going to see such type of some of the important drugs that usually in our traditional practices we will keep in the clinics. So these things what we are going to discuss is one of the important part in the prescriptions. So when you are planning a prescription, writing a prescription for a patient, the main gunas what you are utilizing, 41 gunas. So 20 gunas we will get for the patient diagnosis to understanding the plans and all these things. Another set of gunas are there. What is that? Paradi. So paradi guna is one of the important guna that making and the selection of the medicines. So on that para means what? So the most superior one. So that is great. So when a patient is coming to you with a diarrhea or a dysentery like that, so you need to select a specific potent medicine that will be effective for that. So we have to go with a specific type of drug. So that drug can act on that particular condition very effectively. So if you have a musta or yesterday we saw kudaja, so kudajo adisare. So if kudaja if you have, you can tell the patient to take this bark in a small piece with this, then so that the condition will be effective. So one thing you have to include is this akriya, paradravya in the prescription. So this will be very easy to understand the plans also for their pharmacological action. So whatever the formulation, main formulation if you see in all the Jwaram from to Vadarakta area, you can see that Acharyas used these techniques. So Musta will be coming or Amrita will be coming on the first drug. And then last if you see the Vadavyadis, you have to see that Rasna is coming. So they are naming that itself, telling you that this is the action of this. So you can use single drug as it is, or you can use the main drug in that compound for the particular conditions. So we can just go through that information regarding what is Antriya and all these things. So with all your permission, we can go through that. So first we have to understand what is Agriya. In what depth our Acharyas are told about Agriya. Agriya, you know that. Agriyanam Vigara Samagatva Nidhanam Pradhanam Vichate. Very clearly mentioned. Vigara Samagatva. So it's specifically going to the Vigaras disease. So how a Vigara Samagatva is possible? Vigara, why Vigara is occurring? Because of Dosha Dosha Samurchana. So we are breaking the Dosha Dosha Samurchana. They one drug which can able to do this dosha samurchana vikadam. So where this dosha samurchana is occurring? Dosha and the dosha will be samurchana is occurring in which part of our areas? In the Srodasas. So in particular Srodasas there will be a visheshana of dosha and particular visheshana of the Sroda Dushti will occur. What are the types of Sroda Dushti which is occurring? Sangha and so in Rasadadu there will be a Dhatu Dushti will be there. On that, you can expect a Sangha, or you can expect a Vimargamanam, or we can expect a Nadipravati, or you can expect a Siddhagrandhi also. So like that, in all these Dhadus you can expect. So depending upon this, Acharyas have selected different AGROUSHADAs. So that's you are going to see. So here Agriya means, this is the important thing we have to keep in mind, that can able to break the dosha samurchana in that particular slodas so that that disease can be get rid of. And then Acharya is telling that how it is happening, Agriyanam Balavat Karmane. So with their potency of action, most effective few layer of that potency, it balavat strength, it will get rid of that vigara. Then again Ajay is telling that vigara samagatam and then tada anutpannanam swastha parivarana. So it is not only not doing that vigara samagatam, anutpannanam, the reoccurrence of that particular disease will be prevented. At the same time, swastha parivarana, so it can be used as a rasayana. So in a rasadadu, if there will be a weakness is occurring, one drug that can do the disease cure. At the same time, that drug can act as a rasayana to that. That is the specialty of this. So you are going to see such type of drugs which can pacify the diseases of that particular process, along with the understanding its action in the preventing of the reoccurrence of the disease and the rasayana like that. So if you understand this type of karma, kriya karma, that is or the physiological activity or pathophysiological activity occurring in these dhadus, you can use this for any diseases which is occurring in the rasada or rakta dhatu like that. That's the specialty of our Ajaya's configuration of these types of things. So we can go through some of them. So and it is a parajigal savadana. So this is one of the important drug what we are saying. So here you are saying, you all know this drug, you are studying, no? Musta. Musta is one of the Sangrahika, Deepaniya, Pajaniya drug. And Musta is one of the important drug for Jara. So this is the Musta plant. And one from this there will be a wire like this, a root will come and it is giving time to a nodule. Then again it is coming like that, like that. So if you see, such a thing is where it is occurring. Whenever there will be any primarily inflammation is occurring in our body, the three things what will be happening is heat. One is the heat will be there. Then another thing is some secretions, swellings will be there. Then the third thing will be heat, inflammations and pains or like that feelings. So this redness like things will be there. So everywhere, in internally also this will be. Then what is the first response in your body it will take place? This lymphatic systems will be. So it may be in the intestine or maybe in the body's other parts also. So wherever there will be a lymph involvement or a rasadadus like that or lymph node will be enlarged, the drug which is growing on the watery areas which is having a very similar structural feature as similar to that of this. So there will be a long lymphatic system, then the nodules will be there. So it's called as Grandhila. And what the another synonym of this drug? Another synonym, which animal is eating this? Pigs, Crodesta. So Acharya has taught two important synonyms. One is Anubhaja, which is growing on the watery area and it's eaten by the pigs. So a plant which is grown in the watery area, what may be the difficult situation the plant will face? It may decay very fast. So today we saw the roti plant. So just to be kept outside, it becomes sugar. So it is growing under the water. So need so much of moistness. On that time, what will happen is there are so many bacteria and fungus and the chances of decay will be there. So the plant has to produce opposite qualities to withstand in that particular area. So Musta will produce so many opposite qualities to withstand that area. So pig is a one animal which is living in the so much dirty place. They are susceptible for various types of problems. So the pig will go and eat it. Maybe some human beings saw this. That pig is eating these things and the pig will be very active and like that. And they start to take this and use for various purposes. So even a Jwara, first stage of Jwara or in a first stage of Adisara, the first thing is our lymphatic, these things will be affected. And we need such type of a drug which can modify and get a very good action. Another synonym of this drug is, when you break it, what's the smell of this? You are done in practical, no? So the smell of this, if you break this musta, you are done now. Shadankam and all this, when you are crushing a smell will come now. It's a sugandhi. It's a very beautiful smell is there. So such type of a drug which is growing in watery area, and Bhavaprakash Acharya specifically told that Anupajala Prashastam is the musta. One which is growing in the water area is very good for these types of things. So in your clinic, if you musta is there, one thing what we are told is used for Adisara and this Jora-like condition. Another place where such type of a structure will occur, like this small, these types of things, and then swellings will be occurring. Where in anatomy or study the cross sections where we can see such type of a glands and this duct, and then there is swellings like this. Huh? Where? Varicose veins. Then another place. One of the lymphatic systems. Another place where we are in which part of our body this is happening. These types of things. Ducts and then cervix, and then it is connected to one another main tubule. Nerves. Close to the lymphatic systems which there, in which srotas we can see. Annava srotas is there. Okay, Annava srotas is there. Then Rasava srotas is there. Any other special srotas where you can see this? Raktava. Okay. Medova srotas. It's good in Sweda. In any type of these types of watery that up is present now, all the up areas we can use this one, Musta. Any gland? Other than that? Other than that? Any special gland value to females? In males also, some places. So this is that. This is one of the important drug for where we are using this. Yes, Stanya Shodhanam and Stanya Jananam. So there also this is one of the important drug. So that's why Srodopratenia of a drug, understanding the Srodopratenia of a drug is very important. So this drug can act on various Srodasas like that. So if you see where it is acting more, it is having a Tikta Kadurasa. It is having a Tikta Kadurasa like that, and Lagu Luksha Shita Kadu qualities will be there. But if you see the Srodasas where it is acting predominantly on Rasavara Srodas, and Ubadadu is Tanya, and Mala is Kama and Ushma. So wherever there will be a Srodas of related to the Rasadadu, any disease is occurring, in the first stages of the disease, be careful that. In the first stages of the disease, where the inflammation is starting, there we can use this. So in Stanya also, this is very good. And then it's Mala, where there will be excessive Kapha and Ushma is there. There also it can be used. And how many ganas is coming? You see, Lekhaniya Gana. So where you want to body in Krishna Gana, there will be excessive like things. Kantukna, there Stanya Shodhana, Trikashikam, Chaturpadram, Trigolam. These are all related to the which group of people we are using this Trikashikam, Chaturpadram like that? In the pediatrics area, in the Bala Avastha, because Kapha is very predominant there. There to get rid of this, we will use these types of drugs. So these ganas are showing that it is having a specific activity to our Aptadu of the body, and that will be specifically to the Udavoga Srodas, Rasavoga Srodas, and to the Annavoga Srodas, what you told, and Stanyavoga like that conditions. So then you go through that, there will be so many usages will be there. You don't know that where there will be so much of this Kandukina property, wherever we need Kandukina, what are the conditions where we can see that there will be an itching and all these things will come. In Kushta. Then another place is Shitavita. Like then another area where we can see that such type of, yes, where we can see that in which this is, one is Kushta, then the Shitavita like conditions. Then Udarda, Kushta, then another important disease that's occurring in the skin, Sarpa. So then when you are reading the Samhidas or the Chikitsasanas, you go through that. All the places in the first stage this drug will come in the skin areas. Then another is Medhavasrodas. Now we are discussing about the Rasavaha over. Then you go to Medhavasrodas. Medhavasrodas, what are the main problems that's occurring? Staulya. One of the thing is staulya. So excessive staulya will occur, then what will be the problem will occur? Prameha, one of the things. Before that, one excessive staulya person, what are the after some doshas will occur. What are the doshas? Swedana. Excessive sweda. Excessive sweda is one of the important cardinal features. Then what it will lead to? Bad odor of the body. Maybe a skin problems will occur. So what we can do with this, Mustaq? A very simple things are mentioned by our acharyas. If you have this Musta Churnam and some of the Staulya person are coming, they are having excessive sweat and bad odor. Already we mentioned it is Sugandhi. You just give this powder for external application during the bath. So before bath, you ask the patient to make a paste and rub it on the body, leave it for 3 to 5 minutes, and then it will become dry. Just to rub it like an Udodana. Like that, if you tell the patient, within for 7 days, we can feel that the body will become very fresh and this bad odor will go and the Svedavaha will be get rid of. So this is one of the usage of this. Simply we can use like this. Then we go on to the Stanya Shodhana. This is one of the important part nowadays. What's the problem is, when a mother is delivering nowadays, what will happen? All the people's relatives will go to the bakery directly. From the bakery, they will buy all these creamy and all these things. If it is a non-veg, then there will be burger and all the things will be done, and it will be fed to the mother. The mother will land up with Agrimandya, and that Stanya dosha will occur. The thickness of this milk will be so much high. Then what will happen? Always the baby will have respiratory problems, allergy, gastric, these things. And every month the baby is forced to take antibiotics. Actually what is happening? The mother is giving the milk which is very heavy in nature and it is not properly digested by the baby. So what we have to do? We have to advise these types of things. So Musta can be used as a wonderful drug for Stanya Shodhana. There is sometimes the mother is not taking internally also. You can advise that the Musta paste will be done and it will be applied to the breast and leave it for 15 to 20 minutes. Then it will dry, wash it with water, then feed this milk. That itself is helpful for the lightening of this milk. If it is possible, advise Musta Shila Bhaga. If mother is taking Musta Shila Bhaga, then otherwise it simply advise Mustaga Arishta. Or if it is not possible to like that, give some churnas of Musta Churna with 12 grams like that. With any types of arishtam or paratable, something will be there. Sometimes they are taking layas, no? So along with the layas also you can use. So this is one of the very easiest way of Musta will be there. Then in Visarga, so we are telling the Kandugram, no? So we already discussed the Kandugram. So Kandugram, one more place is there, that Arushada, where there will be small pustules will be there and itching will be there, exudations. They are sprinkling of this powder is good. In Visarga, where there will be too much of pustules and all these things are Agni Visarga like that conditions. Acharya is mentioning about the Dara of this Musta with the Shila. So like that, wherever there will be a heatness is there on the first stages of this, you can go with this Musta. So this is one of the important thing for the first stages of Jara also. So there we can see some of the yogas. So this is one of the, before going this, you are knowing about the Shadakapanya, that's why I didn't put that. Musta is one of the important in Shadakapanya. That will help to balance these types of things, the first stages of the disease for Deepana, Pajanam and Sangrahi called. So Sangrahi means, it is a very broad term. So Musta is a Sangrahi. Sangrahanatva. Sangrahi means Mushti Bandhanatva, one which is able to hold the things or constrict the things. There are so many excessive sravas can occur, maybe in the Rasadadu or in maybe the other dadus also. Wherever there will be an excessive secretions will be there, that can be get rid out by this. That's why Sangrahi quality is mentioned. And along with that, the first stages we need Deepana Pajana, one which can increase the Agni and one which can get rid of the Amato also. So this drug has having three important pharmacological action of Sangrahi, Deepana and Panchana. So this is one of the very important preparation we can easily adopt and can give to the patients and advise the patients. Nowadays, most of them are having a technique but is unnoticed and telling it as an IBS and other things. So whenever you ask a patient who is coming to you with different types of muscle pains, sometimes they will tell that I have a pain here, and sometimes here, sometimes other parts. Most of the time we will diagnose it as a fibromyalgia and so many treatments are these. Never we will ask about the digestions and all these things. So we have to, when you are taking the history, you should restrict to ask them how their digestion. Examine their tongue. Tongue examination is one of the important things. Anything is there, then there will be a contact that things will be there. And along with that, they will tell that they have a bowel habit of more than 4 or 5 times. Whenever they will take the foods, they after half an hour, they are going to the. So this shows that their koshta is not correct. We need proper Devana Bhajanam like that. Especially in the children's nowadays, this is happening because of excessive antibiotic taking and excessive other drugs and food character features. Incompatibility of the food is one of the most harmful thing nowadays happening. One of the incompatibility you all should remember is we always compelling the children to take 1 glass of milk along with a banana. It's a very incompatible thing. Don't give these bananas along with milk. Such children are susceptible for various types of hormonal imbalance and abdominal problems. So these things we have to keep in mind. And this Musta Takra can get rid of many type of disorders. So recently, 2 days back, one of the great Acharya of pediatrician from Kerala has expired. So he is nearly 85 years of age. So in his life, his practice, he told that he is continuously used to this preparation, this Musta Takra. So it's very simple to prepare that. Take that Musta, 200 number you have to select. A good Musta of 200 number is selected, then crush it. 1 prasta of water will be added and reduce it to 1 prasta. So 1 prasta of water will be added to this and take the kashaya. This kashaya will be poured into the shira. Then jala 3 prasta has to be added. Then you churn it well and prepare the takra. So this takra you can give. So keep this takra. So in our practicals, in the seminars, these workshops, we are usually preparing this. So on the first day you have to prepare this and then converted the Shirabhagam into that and kept like that and made takra. From that takra you churn it. Churn you will get the navnida. That's having a very good taste. So you can separate the navnida and you can keep like that. And this takra can be used for 7 to 8 days like that. So this Musta Takram is one of the very good drugs that nowadays we can advise for the people. So very simple preparation. Even in your clinic also you can prepare it and keep it in the fridge. Whenever the patient is coming, don't tell that this is Musta Takra. In a 200 ml of bottle, you give it and tell to take like that also, it's very easily good. And along with that, you find that there are some other drugs are needed. Keep something to Ashtajurna or Ashtajurna like that. Its action will be more. So like that, this is Musta Takra is one of the important things that you have to keep in mind. Nowadays, the most of these types of problems can be get rid of by this. So now, one more. So here you are seeing a drug which is having a Tikta Kadu Rasam, a bitter and pungent taste with the Legu Ruksha Guna. But its virya is Shira Virya. So in the first stages, what the thing is that we don't know, there will be an inflammation and heat will be there. So the heat will be getted out by this Shira. And then it is having a Levaruksha. Because of it, Levaruksha, it is able to do the excessive secretions will be prevented. And the Sangrahi quality will be attained. And because of it, Tikta Katarasam, it can able to do the Kapha and Pitta control. And end of the digestion, that is also important. End of the digestion, again it is light. So it's not difficult to expel out. So that's the specialty of this Musta. So whenever any diseases related to these types of Aptadu is involved and recently occurred, we will go with these types of Musta internally and externally. So even in Marma Vikada, you will see that Marma Vikada Chikitsa also, in the first stages of Marma Vikada, external applications will be having a main grade in this Musta. So this we have to keep in mind. Now you will read all these prakarnas. You can see that this will be extensively used in the Jwara, Adisara, Virahani like conditions, and even in some stages of Harsha like areas. Then go to the Kushta, Visarpa like conditions, and even in some extent in some part of the Rakta Pittam also. So this drug has having a specificity towards the Koshta of Annavagasrodas and Rasavagasrodas, Stanyavagasrodas and Uddavagasrodas areas. But you have to see that it is a Shita flow. Once the inflammation is crossed, the disease is going to a next stage. There this will not work. There we need another drug. Yes, please. Next. This another drug which is having another qualities. That is, here also you can see Deepaniya, Pajaniya, Sangrahya. There also Deepaniya, Pajaniya, Sangrahya. Why Ajaya has selected two drugs? Because this is a drug which is growing on the, which is where it is growing, this Adipusha, where it is growing? In the Himalayas. Where there will be cold and ice falling. On that area, this drug will grow. So if a drug is growing in such a high altitude, which is where there will be exposed to too much of wind and all these things, which may be the virya of this drug. Ushna. So it will produce Ushna. So in the latter aspect, so in the latter aspect, if you want so many things, it is Kadu Titta Ushnam. So it is so Ushna. So in latter aspects of the disease, we need a Ushna with the Pajana Deepan. So in the first stages, we can go with Musta. But in the latter stages, we have to go with the same drug which is having an Ushna quality that can act on the same Srodasas. Where there will be an Annava problem is there, where there will be a Grahani and all these things there, we have to go. So if you see the Chikitsa of Amaja Grahani like that or Amaja Adisara like that, this drug will play more. This drug is coming more on that particular thing. So that's Adipusha, which is also having a Kadu Tikta Rasam, Yedu Ruksha Gunam and Ushnam. Here it is Ushnam and Kadu. So it is having another extensive quality is Vishaktam. And Leganiyam again, Leganiyam and Arshagram, and Shiro Vilajanam, Trikarshikam and Chandrabhadra. So this is also one of the important medicines for children. So that's why one synonym is Shishupeshika. So it's the best medicines for children. And it is a churna, simple Adipusha churna. Nowadays it's too costly. That's why we can't use it in such a form. But its dose is very simple. Even below 1 gram, it's enough for children with honey. So there will be the matter of that costness we can reduce this. So this is also a same drug that can act on all these diseases in the after stages of the disease, especially in the Koshta. So Musta will be acting above this umbilicus area more. So where there will be an Amavakvashiyam area, there Musta will be having an above that area, so Musta will be very good action. But below that, if you want in the proper Grahani, below there will be an action. Adipusha will be the main drug that we can use. That's why it is one of the important drugs in Arshagina. But Musta is not that much of activity in Arsha-like conditions. So sometimes in South India, we are not getting this Musta. So here this is one of the ideal example that how we have to find out a new drug source that can also be as effective as a Adipusha. So here when we are not getting the Musta, the Avaidyas are forceful to select a plant which is having such a property, such a pharmacological action, and how they are invested these days. So just to click on that video, side video. Water it goes. So you are seeing now this is a big river. A very fast flowing of the current will be there. Here you can see that this. So on the banks of this river, there will be mud will be there. When you put your legs, it will go downwards. So on the banks of the river, you can see that a particular plant is occurring here. The fruit flower will be like this. So this indicated towards a specific type of more Agridatta, as we know. So a plant which is growing in these types of muddy with such type of character features. So here the mud is such a packed means the oxygen is very less. The air for that particular plant is very less. So it needs a more pressurized situation to find out its essential needs. So the plant will go for a stress and strain like this it will be there. You can see here. So when the water is going on, when the river is drying, then it will be exploited again by the wild boars. The wild boars will come and remove the stones and they will eat it. And it is looking like a similar as that of a Adivisha. Adivisha, if you break particular, you can see it is having a white yellowish color. So such type of Adivisha will be there. So this is called as Nadi Adivisha. Nadi Adivisha. And they start to use it. So this is one of the important medicine that has having a similar action as that of a Adivisha. Aconitum heterophyllum. This is the Cryptochiron spiralis of the Araceae family. And now the studies are showing that it is having so many chemical compounds that will be having an anti-cancerous property and it's specifically acting on the intestines. So this is the way how they are identified. Interesting, another thing is the pH where this Adivisha is growing, Aconitum heterophyllum is growing is 7.5 to 8 pH. Here also, the soil where the mud is there, the pH is 7.5 to 8. So where there will be such a geographical predominance is there, the plants will secrete such type of compounds that can overcome the particular situations. So the geographical understanding why we are stressing, yesterday also we are stressed and see so many plants are compelled to produce such type of things. We saw such shallagi. Why shallagi is creating such a type of exudations? We also know that exudation is coming and it is very aromatic. Why shallagi is forced to do like that? Because it's a plant which is growing. Where it is grown? It's a jungle desha, very harsh environment. The water is very less. So if the plant needs a life with water, water is the essential part for the plants. So then what the plant will do? Plant will secrete this water into another form. If they secrete as like that of a carallum or something like that, today we saw this plant like that, what will happen? All the predators will come and eat it fast. So these trees, what they will do means, they will convert this into a oleocumbrosin like that, which can't be eaten by that and it can be protected from the environment also, which will not be easily evaporated. That's why the shallagi is having that property. Then we are using for Sangha or something painful is there, we will using for that to remove that. The same thing in Gugulu also. Why Gugulu is forced to do all these things? Because of this. So environmental stress is the most important factor to produce an action in the plants. The plant will do like that. So here also, such type of things is one of the important factors that we can use for identifying a plant resource that can be used for a similar pharmacological property. So this is the way how Ayurveda is looking on Desha first. And then to the nature of the plant. Then we will select a particular plant for the pharmacological action. So this doesn't mean that if you are not getting an AGROUSHADA of your age now, that mentioned in our classics, it's our duty to find out a new AGROUSHADA with such type of needs. For that purpose, what we need, the things what yesterday and today we done, is thorough surveys and studies. So that you can get information and you can get the similarity of the plants that is occurring on our these areas. Okay. So next in the clinics, one of the important things is bleedings. There are so many types of bleedings will occur. In any types of bleedings, if you take these things, keep it with, and then you can give it with along with any types of medicines like Vasa or Ashoka. Sometimes the bleedings will be occurring in through the upper also. So we can go with the Vasa like preparations. Sometimes the bleedings are occurring nowadays in clinics more related to lower part, especially in the ladies, maybe through the urine or maybe through the excess menstruation like that. You can select any preparations of your own. Along with that, if you add this type of things, especially the Utpala Kumuda Padma Kinjalagam. Kinjalagam means these stamens. Rekta Vitta Prashmanana. So the stamens of lotus or small nymphaea like species, white lotus like that. So they are simply falling down and going out. whenever you are getting an opportunity, collect it, dry it, and keep it in your plate. Then whenever it is needed, you can take it. There is no need of powdering itself. You can add to this preparations, whatever the preparation is there, onto that or with any other things, and you can take it. So this is one of the very good thing that all these stamens are sangrahi and Tikta we can use for this. And it is Dasa is Tikta Madura Kashaya. And the important thing is, however, why it is will be this doing because of the Stitha Pichilatvam. So it is having a Sandhaniya property of Stitha Pichilatvam. So wherever there will be excessive blood loosening will be there. Excessive loosening of the blood, Dravatva will be increasing in any malignancy also. In any that types of things, lab reports will be there. You go with these types of drugs. So these types of drugs can do a Shidam also. It will cool it, and the end of that it will be temperature. So along with the Shonaga Tokka and Patma Kesara Kundaliga covering with the Kashmiri Patra, then you do the Pudabagam and give to that patients, then there will be bleeding through the Adisaras. Whenever there will be motion and this Asadya Adisaras like that, Pravahiga like condition, Susruta Jere is mentioned. And another use is, this Patma Kesara is one of the very good Varnya. Patma Kesara, the Guliga is there. So in all types of that markings and glowing of the skin, we can make that is Patma Kesara. Patma Kesara, you can use as that of a Kunduma. So milk with the milk, along with the milk, you macerate it and you can use for application. Or along with the honey also it is a good thing. So when there will be so much of oily skin is there, you can go with the honey. When there will be so much of dry skin is there, you can go with the milk. You can use coconut milk also. So this Patma Kesara, so all the part of this, the patra, the petals, the stamens are very useful. The patra of the white lotus is one of the very good nutritive. So that will be dried and kept it when you can add to the milk and you can drink it as a nutritive thing also. So this Patma is one of the good drug for Rekta Pitta conditions. If it is so severe and it is so much of malignancy like that, problems and bleeding disorder is there, another drug you can add is the Laksha. So combination of Laksha along with this Patma Kesara and prepare Shirabhagam is one of the very effective in various types of bleeding problems in Rekta Pittas. Next slide please. So this is a park. Yesterday we are not seeing the mature things. So today this is a photo of a matured bark. It's similar to that of intestines. This is the Kudaja bark. So again, if it is a lower tract, so much of bleeding is there. One of the drug that we will use is this one, where there will be Sleshma Pitta Rekta Sangraya. This is equal to Sleshma. Sleshma means there will be a mucus exudation along with the, because there will be blood is going. This is the drug of choice. So here also we discuss Kuruchi bark like that, dried it and keep it in your home or in the clinic. You can advise that you prepare the Shirapagam. Kudaja Shirapagam will be there and taken will helps to relieve this. And Kudaja Tok there will be used for Kudapagam also. And it is one more thing is it's useful in Ardha ulcers also. Bleeding piles will be there. There also we can use for this drug for Ayurveda. Not only this Kudaja Tok you can make it a Kashayam. And Kashayam and that Kashayam is having very predominant Kashaya Rasana. This will be added to Marma Guriga like things or Patanjuka the Churna. You add this and make it a heat and do for Layakam also. This will help to reduce the cervix. So Kudaja Tok is Sleshma Pitta Rekta. So wherever there will be some type of an excessive thing is there, as a Layakam also we can use for this purpose. So this is one of the drug that can be used for lower tract. At the end of our excretory system, anything which is having a bleeding and this is the one of the drug. In upper extremity means which drug we will go, where there will be more bleeding will be coming in the upper extremities. Vasa. Vrisho Detta Pitte. Vrishatu Ambika Asaknam Detta Vitta Varanga. So if it is in upper areas, we can use the Vasa leaves for that purpose. That is also one of the important things. So one plant you must grow in your clinic and near to this is Vasa. Why means Vasa can be used for this purpose. Vasa Swarasa, if you take, you can add that with it to the Talisa the Churnam or Sudokala the Churnam, and along with a little honey, if you advise, that will be very good for long standing these problems. And another thing is, always our Ayurvedic physicians are advising so many oils for the patients. And some places, if you add cotton chukadi like churnam, or maybe some varnia, some application with these haridra and all these things, you are doing, then what the thing means, some allergy will take a chance. Nowadays, so many persons are allergic to turmeric. So such type of allergy and urticaria will occur. The best thing is you take the leaves, cut into small pieces, put it in water, boil it, and ask to wash that particular dara. Suddenly it will stop. Within 10 to 15 minutes, these types of allergies occur due to oil application or due to these types of labor application will stop. So sometimes we will go with the Kolavada Churnam or Kotta Chukka Churnam or Uddardana to the foreign patients. Suddenly urticaria will arise. So if you do this dara, because it's Rekta-Pitta haram, so that Rekta-Pitta like treatment if you give, it will subside. Another area where if you have a vasa is, you can advise is, it's very good for the pigmental problems that are related to the varicose vein. So you can see that so many persons are having an angle, there will be small black patches. So tell them to, night before going to the bed, tell them to wash with this vasa swarasam, and where the cook leaves is there, no balance cook leaves, that should be rubbed on that particular area, or they can keep this as an avagaha in the legs like that, and advise them to do the massage from downwards to upwards and go for bed. Like that repeatedly if they do for 7 to 21 days, you can surely see the changes there. The pigments will be reduced, the thickness of that tissues will be reduced, and it will become soft, and the circulations will be changed. If you have more things, externally we discussed Nalpamaram. Along with Nalpamaram, this vasa leaves is another wonderful thing. You can advise for this varicose vein. Other things there is no need, but if you have varicose vein so much is that this Nalpamaram, this Panchakshi leaves, along with this vasa leaves is very good for night, these types of problems. So like that, vasa is one of the important plant you have to keep in mind, because this is very important in nowadays, because so many respiratory problems is occurring. So when you advise Talisadi Churnam like that, one thing you can use is vasa, or another one is tulasi. Simply tell that 5 or 6 leaves of this tulasi will be put it in the water, boil it, and then that water will be used for mixing this Talisadi Churnam you can take. That also a good thing. Another respiratory thing, one leaf you have to keep it in the house is, one is tulasi, another is vasa, and another is Karpuravalli, Parnayavani, Coleus aromaticus. So all types of influenza virus, this is one of the very good things. You all know that plant now, Karpuravalli, where the leaf is fleshy and round, Coleus aromaticus, Parnayavani. So that leaves having a lot of sorasa. You can grow very easily. You take one stem, dig it in the soil, the plant will come. Little bit water is enough. Suddenly the plant will come. That leaves has having so much of potency nowadays. So you take one leaf and put it in one glass of hot water, and sip by sip you take that one, you can get rid of the tonsillitis and the throat irritations. Especially it's very good for children. And another thing is, in our tradition, our grandfather and our teachers are used to prepare is, Rasadi Churnam, everybody is known. We are going to apply it. The potential in this Rasadi Churnam is this Parnayavani leaves. We will take the juice of these leaves, and if 100 gram of this Rasadi Churnam is there, we keep it in a steel plate and pour this oil, this sorasa, 100 ml sorasa. Keep it in sunlight. Like that 3 times we will dry it. That Rasadi Churnam is very effective for fumigation. If you have this congestions and sinusitis like that, put this Rasadi Churnam along with a little rock salt and take fumes. It will help to get rid of that. If you have severe headache, take this Rasadi Churnam processed with this. A little bit of lime juice you have to add it and heat it and keep it here. Headaches will be get rid of. If you have mumps, tonsillitis, the same process you can apply here also. So like that, and even this Rasadi Churnam you can use it for gargling, tonsils or adenoids is there, no? That will be very big, then we can go for this. So like that, yes, a drug can be, yes, main drug is there, you can potentiate this with another drug. So Vasa we told now, Vasa Swarasam, if you have plenty of Vasa Swarasam, you can potentiate that Vasa Swarasam with another drug which is very good for respiratory lungs problem and for Rasayanam. Which one that one? One of the Kadurasa Pradhana Dravya which is very good for lungs, cup and all these things. Yes, Pipali. So Pipali is dipped in this Vasa Swarasa and try it. Like that you can repeat that. And that Pipali is called as Pavida Pipali. It's different varieties of Pavida Pipali is there. One of the leaves you can use is this Vasa. So this is a Vasa is one of the wet drug that you have to keep in mind. And another drug is Tulasi and another one is Parnayavani. These three drugs are nowadays very important for the Pranavagas rogas and these throat and upper respiratory problems. So anyway, this is the one Kodajatok. If you are getting Kodajatok, you have to keep it like that. So here, you can see that when we are yesterday we went, next month if you are going, you can see all these fruits will be mature. Collect the fruits and collect the seeds. That is the ingredient. It's what we are discussing. It's very thick tarsa. It is having a cremicula property. Simply macerating that with the water and applying and also having get rid of the itchings and all these things. And another thing is, it is one of the important in the Shat Tandula, 6 grains that is used for Divanavadu. So that is one of the good drug that you can store in the clinic also. Next. So another drug is Sariva. So when a patient is coming to your clinic, usually you have to look into all the activities of the patient. One of the easy way to get that disease into a normal way is, the most important thing is the food and the drinks. So especially Panakalpana. Panakalpana we can tell the patient to do with the simple ways. So if a patient coming to you with so much of gastritis like this, and always they are telling that they have gastritis, the ideal way is using of a Jeeraga. So tell the patient to take Jeeraga, 1 teaspoon of Jeeraga. If it is severe patient is coming and it is very acute in nature, tell the patient to take 1 teaspoon of Jeeraga in a mud pot. Then ask to fry it. When it is become brownish in color, or 1 teaspoon we put 1 liter of water we have to pour it. Then boil it. And sip by sip taking that will help to get rid of that gastritis things. So advise that patient to do like that when it is too acute in nature. But if it is a chronic, not that much affecting, simply advise that add Jeeraga and then prepare water. Whenever you are telling the Panakalpana, properly you tell how much dose it has to be added. Sometimes the patient you are telling Dhaniga, you tell Dhaniga to add and you drink that Dhaniga water. What the patient will do? Patient will take 1/5 of Dhaniga, put in 1 liter of water and boil it. Within 3 hours it will become very thick and very difficult to digest and gas will occur. So this is one of the important things, we have to reduce the dose on it. So likewise, here also, this is one of the important drug. If it is there in your home, you can tell home or in the clinic, you can tell the patients when there will be too much of burning sensation and you want a blood purification. This is one of the good. Ananda Sangrahaiva Rektavitta Prashna. So where there will be, patient is always having a rise of ESR and rise of eosinophilic conditions, or nowadays you are seeing now some EEG. EEG, blood, there will be an allergy, this will be more than 400, 500 like. Yes. So more than 400, 500 like that patient will come and they are undergoing some steroids also. But one of the very good drug that you can suggest is this one. This root, if you are keeping like that, powder you keep like that, 1 liter, half teaspoon powder is enough, boil it and tell them to take this water for blood purification. So all the skin diseases, where there will be too much of food hot in the body, we can give this one. And it's very good aromatic and very good for taking also. So along with that, you are feeling that the patient is too not hot. The patient has probably having somewhat of other problems also related to the urinary things, where there will be urine is not going properly. They are not having some burning sensation in the urine. Equal quantity of Ushira has to be added. So Ushira, vetiver. So vetiver is also added to this, and then you can prepare. Another drug you can advise for this is the Kulanava. So better is in your clinic you can make a combination of this 100 grams of this Sariva, 100 grams of Kulanava and 100 grams of Ushira. So we'll completely make it all are very good aromatic and this, and tell that 1 liter of water, you add 1 teaspoon of this and give this. So this is what we are using. So if someone has diagnosed as a thyroid, TSH is high, not taking any medicines, a recently occurring thing. First you just give this for 21 days, 3 weeks you advise this. 100 grams of the packet has to be given and tell that patient to take this continuously. Along with that you advise some other medicines also. Most of the time it can subside with this only because it's a Rekta related problem where there will be more Ushna will be occurring and there will be an involvement in the Rekta Dhatu and the same time in the Mutraga Srotas and Udavaga Srotas. So these three Srotas are involving on all type of these types of thyroids. So in such a way you have to assess. Simply giving some Taishwarokulu and all these things will not work on these conditions. So most of the time we will go for such types of fabricated and what the things are in the clinical practices. Don't fall in such type of traps. You go just with your observations and your analysis of the things and then you select this. So these types of combinations of small drinking powders, always in your clinic when you are starting, if you are not starting your clinic also, you keep any types of these powders in your house. Your relatives will ask something for that. Most of the time there will be micturition problems. There will be micturition is a very common nowadays because everyone is sitting in the AC and not taking the water properly. So they may subside to this. And another thing is recurrent urinary infection. This is one of the very good things. If you have Purana Vashtaka Kashayam like that, you can give. But simple thing is like this, a combination of Sariva, a combination of Ushira and a combination of Punana. So these things are very easily available and not a costly one. One thing you have to keep it in mind is the good quality of Sariva, you have to select it and then you have to use it. So anyway, this is you can use. Again you can see that this drug will be coming in Joragra, Daha Prashpana, Stanya Shodhana, Purusha Sangravanyam and Madhuraskanda. So again this is a drug which is having a very good action on the Rasadhatu along with the Raktadhatu. More than Rasadhatu, it is having a very good action on Raktadhatu. This side. So wherever there will be a blood purification and any derangement in the blood parameters you are observing, it is too high, we can go with the Sariva like that things. So if it is not possible to get that, you can go with the Sariva, the Asavam like that conditions also. Yes. So this is one of the important drug, all know which one? Buddhiji. So how many pharmacologically important karmas are mentioned by Acharya? Sangrahika, Madhakara, Dibaniya, Sleshma Shonida Vipanta Prashpana. So it is one of the very best Sangrahari action. Then Dibaniya, it is will do the Dibanathon of that. And another thing is Sleshma Shonida Vipanta Prashpanam. Wherever there will be a Sleshma and Shonida will become Vipanta. Or separately there will be any Vipanta. It is not only related to the any that Koshtavalli or Purusha also. Vipandam can occur in any source, even in the Upadadhus of the source. So there also, even in the Manadhatu also. So we are here, we have to think about the Dhatu Agni and the same time Mala and Mala Agni. So this is one of the drugs which can act on all these spectrums. So where this Sleshma and Shonada is vitiating in most predominantly in which dhatu? Raktadhatu. Raktadhatu is very susceptible to for this Shonada. Next where it will can do this Sleshma and Shonada will be affecting in which dhatu? After Rakta, Mamsa, then Medas, and then afterwards Majja. So this is a drug which is having an action on Rakta Dhatu and along with that it's having a very good action on Medo Dhatu and Majja Dhatu, especially Majja Dhatu. So the diseases which is you are expecting that it is occurred due to Rakta Visheshan or Majja Visheshan and the disease is precipitating in which Roga Marga, what are the three Roga Margas where the disease are more predominantly precipitating? One is the Bahir Roga, another is Madhya Roga, another is so the Bahir Roga Marga, wherever there will be a Rakta Dhatu involvement is precipitating and showing the Lakshanas, the most important drug is this one. So where there will be recta is giving a problem to our body and creating a specific type of heat and other things in our body. In the jara also it is happening. So this is one of the important drug in that. And whenever there will be a recta is involvement and there will be problems to the vada related problems in the recta vada, this is one of the important drug. So very common drug, but unfortunately we are not exploiting in the proper things. So here also the identification of the Buddhiji is one of the important things. Unfortunately, in the field we are not able to tell this. This is one of the important factors because in the media nowadays, a propaganda is there that someone has taken Buddhiji and they are fallen with some problems and liver toxicities. And so many allopathic doctors are claiming that this is. It's completely bogus. Why means they have not done a proper study of which Buddhiji we are using. Someone has taken some Buddhiji in the Bombay area, that is totally different. It is not at all a Buddhiji. What the Buddhiji that is using in our Ayurveda is very specific. So how we are identifying that a Buddhiji in the correct way? It should be a very good step with the proper that projections you are saying. That's called as lenses. That small projections will be there. That is not too much projections. So as a medium type of projection. If too much of projections with the green color will be there, then that Buddhiji is another one. That is Dinospora crispa. It's too bitter. Nowadays in the YouTube and all these, some of the people are promoting it will keep away the diabetes and all these things. If you continuously consume that, because of that too much of bitterness, it may produce weight loss and so many problems. That Buddhiji is not at all the Buddhiji of Ayurveda. And another Buddhiji will come in where the stem will not have any lenticels. Only one or sparing lenticels will be there. That is the Dinospora malabarica. It is a Pinta Buddhiji. That also not using in Ayurveda. So what the Buddhiji we are using? The Buddhiji which is having these types of character features. Here you are seeing now the stem. Where will be a little bit of lenticels will be there. And the most important is these leaves. You observe the leaves. Varnam. This is the character feature of Tejas. So the proper glowing and shining is one of the main identifying feature of that plant. So yesterday also we saw some leaves which is having such a glowing and glaziness. Today in the water we saw a plant. Under the water itself, this plant, it's having a shining leafness. So under the water, if it is producing such a shiny leafness, means it is also having a Teja. So this is the real Buddhiji which is having this Varnam. So this Buddhiji we have to take. And it should not having any hairs or roughness. If you touch that, it will be very smooth in nature because of the predominance of, along with these Tejas, Prithvi and Aptattva will be there. So this Buddhiji, if you consume, it is having a very good balance of all the Panchamahabhutas. So that at the end of the digestion it will be a Madhura Vibhaga. The other two Buddhiji will not undergo this Madhura Vibhaga and it will produce these problems. So that time also our Acharyas, all Vaidyas knowing about all these plants, they didn't use anything. Now also from the dry drug shop these Buddhijis will be taken for Amrita Nishtha preparation. The Vrta Vaidyas will carefully look after that and they will separate all the other things and then they will use this. And one more thing we have to keep in mind is we have to remove the external layer of that. External layer is very difficult to digest. So remove that and then you cut it open. Again, if you have any confusion, you just go for the which Lakshanika? Chakra Lakshana. So observe the Chakra Lakshanika very carefully. So there will be a pith and there will be vascular bundles will be there. So vascular bundles will be look like the wheel appearance because of that wheel appearance. If this vascular bundles below 12 in number, that is Dinospora cordifolia. If it is above 12 in number, this vascular bundles, then it is not Dinospora cordifolia. So likewise also, if leaf is not there, we are unable to see from the stems. We can observe through these things. That's why they mention that particular synonyms also. So this type of Buddhiji, if you have, you can cut it. Usually Acharyas mention that Sadeva Agravayojani is the Buddhiji. But in certain conditions, in clinical, we are not able to do it. Within 1 month, it will be there. If you collect this, in 1 month, there will be no problem. But after 1 month, it may lose its potency. Otherwise, you have to grow it in your home. Then surely, whenever you need it, you can take it. So, If you have dried one, you dry it. And whenever it is needed, you can add double quantity. And then you can prepare the kashayas. So some of the simple kashayas you can prepare is with gudijis. So we can go through that, some of them. And one more thing you have to keep in mind is the leaves. The leaves is one of the very good thing for stomatitis. So whenever you are having some problems with the food administration, you have gudiji, it is there. You just take the terminal buds. It is not the having thicker rasa. That's why it is called as Vatsadani. It's liked by the calves. So that's the leaf that will be used for Shagarga. Gudiji is mentioned in Shagarga. If you take the mature leaf, it will be too bitter. So whenever you go to the field, you can see that those people collecting the leaves, they always collect the chigiri, where there will be a terminal buds only they will collect it. So when a Shagarga plant is mentioned, don't take the matured leaves. You have to take this type of terminal leaves and use it. So this will be chewed simply, also helpful to get rid of these things. Because the leaves containing so much micro compounds like magnesiums, calciums, like things will be there. So many vitamins will be present. So gudiji, another thing is gudiji leaves if you have, you can make a paste with milk and made a poultice. That poultice is used for Raktavadas, where there will be swelling in the knee joints and all this. No? Gudiji patra, deva is there. Stomatitis, the leaves can be chewed and you can take internally. 2 or 3 leaves if you take like that, or instantly you can get relief from the pain also. And one more thing is, those who are going to exams also for DRAVYA, there will be another synonym is for the gudiji is the viscosity of what the synonym. It will look like honey, like that one synonym is there. Its viscosity, Amrita, like there will be one synonym. Madhuparni, one of the synonym. So Madhuparni is another one synonym. So it's mentioned that in our that there will be, it is having a similarity that of the honey like that. But it's not that related to the taste. If you take the surasa of this, it will look like a viscous honey like that. That's why it is mentioned like that. So whenever you are doing these 2 things, you can utilize. One is the leaves and another one is the this. Wherever we can use that, we can see. Please. One of the Gudiji Sattva, yes. One thing. Yes, thank you. So this is one of the important things. If you are getting a very large quantity of gudiji, you take that gudiji and make it into small pieces like that, and you can add water and you all know that the gudiji sattva. So why we are preparing gudiji sattva for this? So you can use the kashayam, all these things, no? But why you are preparing gudiji sattva? Yes, you can see that this plant, this is having what type of rasas will be there? Tikta, kashaya rasam and guru snigdha. So this tikta kashaya, what are the mahabudas are predominant? Tikta, what are the mahabudas are predominant? Vayu and Akash. Kashaya rasa? Prithvi and Vayu. So when you put it in the water like that and squeeze it and allow to settle down, and then you filter it and you are allowing to settle down now, what will happen? Which one settle down? Prithvi tattvas along with a little bit of Vayu and the others, what the other things will go off. So this gudiji sattva will not having that much of bitterness. So it will become more rasayana like what it is. So that's why if you prepare the gudiji sattva on that and you keep it like that, it will be very useful for eye diseases and diabetes like conditions like that. So if you are getting so much of gudiji, sometimes some trees are cutting and so much of gudiji you will get, you can go for this gudiji sattva. It is very good for diabetes like conditions also, chronic diabetic like conditions also we can do. So like that, you can prepare a gudiji sattva also and keep it. And that will be a very good rasayana, and along with the Shilajittu like drugs also you can advise that. So another thing is, you see this ganas, again, Trishna Nigrahanam, Daha Prashmanam, Stanya Shodhanam, Triptiknam, Vayasthapanam. These are all first 3, Trishna Nigrahanam, Daha Prashmanam and Stanya Shodhanam, Triptiknam. All are related to the Udavaga Srodhas, Stanyavaga Srodhas and Dhanavaga Srodhas. So whichever the situation is occurring, Lakshana is occurring related to these dhadus, we can go for this amrita. And then Medhi Rasayana will be there, then Vadaraktam and Sandhani. Without Gudiji, Vadarakta Chikitsa is an impossible thing. If it is a Basti also, if it is a Taika also, if it is a Kashaya or Churnam also, Gudiji is one of the important drug in Vadarakta because of its speciality and affinity towards the Rakta Dhatu, and the root of the Rakta Dhatu is which? The Srodhamoolam. So both the places it will be there. So in Ekrapulida, which is the another disease very common? Jaundice. So Kamala. If you see the Kamala Chikitsa, again the predominant drug is this one. So one of the important yoga that very simple, you have to keep it in your clinic in the form of Goda Churnam is this one, which is Amrudottaram. So there are only 3 indications is there, Jwala, Malabandha, Kamala like that. But it is a wonderful drug nowadays. This combination is a very important base for nowadays diseases because all of them are susceptible with the Sandarpanajanya problems, and another thing is Agrimandyam, and another important thing is everyone is having a predominance of kapha derangements and malabandha. Kapha derangement and malabandham is a very important thing that is happening in everybody's bodies. So much of unwanted malas are stagnating this because of our diet. So this is a combination where if you have this amrita and haridaki and shundi. So haridaki is also one another drug we are discussing last. So haridaki is one of the drug you have to keep in your clinic. Haridaki churnam is there, amrita churnam is there. Then tell the patients you mix haridaki churnam and like that, or you can give, or you have to prepare this amritottaram koda churnam and you give it like that. And any type of patient is coming to you with the increase the ESR stamba. Stamba is there in the joints or in the muscles. This is one of the very good drugs that you can use for that purposes. At the same time, they are having a concentrations like this, even in the fever also. So this Amrudottaram, if you are not having, Amrudottaram Kashayam will be there. That also you can use. Along with a little bit of Shundi Churnam if you want, you can tell them to add this when you are preparing that, and then you can take that. So this is one of the important good combination that can be used for various types of these problems. So this is one of the ideal yoga that you can understand the Paradi Gunas also. So this is here the Para drug is Amrita. And how much quantity is taken? 6. That is the Sankhya. The usage will be there. And the Parimanam also. How much quantity will be there. Then the supporting drug with the Haridaki, where it will be 4 parts, so that a Virejanam is also possible. That's Abhara drug. Then the Shundi is there. So like that, a Dipana Pachana Anlomana Dravya along with the Vyadi Pratyeka Dravya on the Vettadadu is used to So similarly, if you are not able to do all these things also, only you are in a clinic with some Amrudottaram Kashayams and some of this, so there will be one combination, good combination that can be used for long term is Amrudottaram Kashayam along with Amrita. In our clinical practice, this combination is used for long-standing Vadaja problems, especially related to these fibromyalgia conditions and cervical spondylitis that currently occur in such persons can take this Amrudottaram Kashayam along with Amrita. The children, those who are suffering such type of problems and long-term fever and recurrences, this is one of the very good thing. In children, only 5 ml is necessary, morning 5 ml, evening 5 ml. So this is one of the Amrita is one of the good combination for all types of allergic problems, inflammations related to the Rakta Dhatu and some extent to the kosha. Some of the yogas we can see. Just like this. Amrudottaram Kashayam, Churnam if you have, add Punarnava. Already we have Punarnava Churnam on that. So add Punarnava Churnam, then it will be good for Shodha. In any edemas like conditions, you can go with this. Especially cellulitic like conditions. This is one of the very good things. You add Punarnava and go with it. Any soft tissue inflammations, this combination you can go. Another combination, it's a soft tissue inflammation. If it's too deep, combination Amrita with Dashamula. That we can discuss afterwards. Then another is Amrudottaram with Sariva or Haridra or Prameha. So a simple Amrudottaram Pada Churnam will be there. Then already we have Sariva. We are discussing now. Sariva Churnam will be there. That you can have. Then Amrudottaram with Trivurt is one of the important for Uttara. So ascites like patient, liver enlargement is there. Then we can go with. So if you are not having the Trivurt is there, you give Abhipati Churnam along with Amrudottaram. That also is a good combination. Because already nowadays the Ayurveda is not acting very nicely because our collection of Dhruvat and all the parts adding is not at all good quality. So that's why it will not produce. But if given a combination with this is good. Then if it is having an Amavada and Shoda, you can add given with the Kirandapaya. This is one of the Kerala practice very commonly, or at least all the Vaidyas with this one and taken on the night. So this is one of the very important thing in Amavada, in our rheumatoid arthritic like conditions, and gouty arthritis also this is good. And another Amrudotaram that is mentioned in Ayurveda. This is also another book you have to go through. It's a book which is preparing about the pediatric treatments, children's treatments. There one another Amrudotaram is there, where you can see that this will be a change will be there. You can't get Haridaki or Shundi. There it is changed with the Bela format and the Devadara Duha. Because the condition is Angamarta and Bhavana. There will be severe body pain. And Koshta is okay, but severe body pain and Vada is high, then we will go with the Amrudotaram along with the Devadaru and this Bela combinations. So where there will be more Vada Kapha or Kapha Vada is predominant and Agrimadhya is there, the Amrudotaram what we are discussed is the best one. But when there will be a Pitta involvement and Vada involvement is there, Vada Pitta, there will be a burning sensation and is there, they changed these combinations. They changed with a Vada Pittahara drug like Bela 4 part and a Vada drug like Devadara 2 part. This is the art of prescriptions. How minutely they have chosen the Amshamsha Kalpana of the things in the person. So that's why Andamartha and Vada if you go with these types. So it's your choice. You can also prepare another third variety of Amrudotaram with another combinations. That depending upon your applications of that. That's why yogas are innumerable. That's your potency and your art to adopt it to another level depending upon the patient's conditions. That's like this. So there are plenty of yogas are there. We are not going through all these things. Madharakta, if you are seeing, there are plenty of utilizations will be there. And in Joratva, Joragara, and Jora with the Kapha predominance, how? The Jora with the Kapha predominance, only simple changing is Pippali will be added to this Gudiji Kasha. Then where there will be a Kamala is there, Gudiji Swarasa will be mentioned. That leaves Swarasa with mother. Like that, plenty is there. This we have to keep in mind. Nowadays it's very important. This Amrita combination with the Shatavari. So yesterday on the field, Sarah has told about a preparation of Shatavari. So a combination of a drug which is having an Ushna Virya Rasayana Dravya with a Shida Virya Rasayana Dravya is very wonderful one. So this is also one of the example. And it is still that in Chikitsa Manjari, Kori Churicha Vadathi, Kurigiruchari, when the body will be having too much of heat and burning sensation in Vadarakta, one of the best drug that you can give is fresh Gudiji along with this Shadavari Shirabha. So any type of severe burning sensation if it is there, go with the Shirabhaga of Gudiji and Shadavari combination. Because both these drugs are having similar pharmacological property to reduce the Pitta, but one is having a Ushna Virya and another is having a Shila Virya. So this combination of this Ushna Shila Virya with similar pharmacology and moreover it is Rasayana. So it will be helpful for the balancing of the strength of that patient. That's why this is one of the important usage in Kerala for all types of other condition where there will be Pitta is too high. Like this. So there are so many things are there. One, this is we have to keep it. If you Gudiji is there in your in the clinic or you have the knowledge about the Gudiji, Gridayana Vada, you can give the Gudiji Kashayam with the Grida. Gridayana Vada, Sakuda Vibandam. If there will be an Vibandam will be there, then you can give Gudiji Kashayam with the Guda. Then Pittam Siddhartyam. If it is too much of Pitta, Siddha has to be given. Madhuna Kapascha. If Kapha is more, then you can invert the Kapha. Then if it is Madharakta, Gurupa Daila Sammishnaya. So if it is too much of what is there, then Vadasta Mukram, Gurupa Daila Mishnaya. Shundya Amavada. If it is Amavada is there, we will add Shundi. So that's one of the things that is seen in the Amrudotaram Kashayam. So like that, this is one of the very important drug Gudiji that can be used in the Raktadhatu Vikaras. Wherever there will be a Raktadhatu Vikaras or there will be a derangement in Raktavasrodho Moolam with the liver and the spleen is involved, you can depend upon this Vyadhi Pradhenika Dravya of this Gudiji on that conditions. So Gudiji should be grown in your homes. It's not only the use of these all these things, it is one of the important drugs that can produce an environmental correctness also. It's very good for Vayu. We have synonyms, Chinna, Chinnaruha, Kandopava. Why that synonym? Because small wind will be there, it can keep for a long period without touching the ground also it will alive. When the favorable condition is there, it will give rise to a small root and then it will grow. What made that plant? Because these lenticels are the respiratory pores. It has a capacity to absorb the air from the surrounding along with moisture and convert it into some other forms. Why we are not using the external things? Ajay, why God told that you have to external bark has to be removed, that is paper covering has to be removed, because it converting the unwanted things and excreting through these things. That's why it is peeling out, and every year it will be peeling out. So that should be the one of the drug for phytoremediation. So if you have a very good green pergola with this Gudiji, that is providing a lot. So nowadays we are spending so much amount for these pergolas in the house with so much of other creepers and all these things. It is an evergreen these things. So we have to prepare a ladagraham with these types of things. Gudiji is one of the such good drugs that can provide it in these types of shades. Another is one of the good drugs is yesterday is Astisandra. That is also very green and fresh and it will be keep in that green. Another one is mentioned in the Ayurveda is Madhavilada or Jasmine, Jadi. All these can be used as a ladagrahas. And Bopadeva is telling that someone who is enjoying such type of ladagrahas and residing there, their mental, these happiness will be going such high level. So such type of things are also there in the Gudijis. That's been on Vishwabheshya. So it look like a very simple drug, but it can be used for various purposes. Simple Swarasa itself can promote various actions. So especially when someone is having a digestive problems and these things, just take the Swarasa or that Gudiji Swarasa, mix it with a little bit of honey, and then we can give it. It will be very good for digestive and all these things. And if someone is having too much of painful, you can take the dry powder of this shundi and then it will be mixed with other things and then you can apply that. And one such yoga is Naguli Padu Nagara. Naguli Padu, only three drugs. Rasna Churnam will be there. Then Padu is Saindava and the Nagara. So if it is there, it is one of the very important drugs for Karna Mungala Grandhishoda. It is not only for Karna Mungala Grandhishoda, any time for lymph or glands, that expansion is there, this is one of the very good drugs that you can abuse. So wherever there will be glandular swelling is there, nowadays mumps is very common again. So this will be the very simple. So just to mix this, if it is you are not having rasna, as it is, rasna the churna with a little bit of quantity of this shundi and then mix it with a little rock salt. Everywhere that will be there, no? That will be made into a paste with jeeraga water or hot water, then heat it and then poultice will be applied so that it will help to get rid of that shodas. That shundi can be used for various other purposes also. That churna will be there, that can be used in the labors where there will be too much of kava predominant is there. So anyway, this is a drug which is seen in so many ganas. You can see Krishnadigrahanam, Trittiknam, Deepaniyam, Shulaprashmanam, Arshaknam, and the Trigadu, Chadrushnam, Panchapuram, Shadrushnam, like that. All these places it will come. And especially one thing we have to see is Krishnadigrahanam. Till now, we go through and Amrita we gone through. All are coming in Krishnadigrahanam. So why such type of things are? Because Krishna itself is having so much that there will be a different presentations. So it's our duty to select the ideal Krishna Adigrahanam for particular purposes like that. Then that other things you know. So in all types of Visheshasya Yogeshu Shundi Sarvapradam Amrada Yuktam Yogeshu. So in all types of this you can add Shundi. So that's why it is called as Vishwabeshwar. Along with Amrita, it is having a specific quality. Forget about this, you can note it. Another important thing is in the shundi in the form of a food is a very important factor. Nowadays we are mixing that. So we are telling that Kadurasa has to be taken in the proper form. One of the ideal Kadurasa daily we have to take is shundi. Nowadays we are not taking this. This will be leading to various types of problems, especially in the digestive and in the end of the digestions where there will be piles, fistula like things. Why it is happening means we are falling in the trap of other Kadurasa dravyas, its name of Hyderabadi mirchi and all these things, and that will be adding to the non-vegetarian foods and then preparing and giving. At the end of the digestion, it is Kadu Vibhaga. But here it is a Madhura Vibhaga. So that's why whenever you advise any type of processing the non-vegetarian foods more in your houses, should use this one. And another thing is, whenever there will be a strengthening some evening food is there, one of the things we have to use is this along with the tila. That's why Chukkirata Churna is there. Especially the young children and the ladies should take this. Tila has to be taken, the black variety of tila. If it is taken 100 gram, you have to add 200 grams of gula, then nearly 100 grams of this shundi churna. Pounded together and mix into a bolus. This bolus you have to take, it's good for proper eliminations of the menstruations in proper way. It will provide a very good strength to the bones and the teeth. So the children should take. Why this yellunda has to be very predominantly using as a food means it is very good for bones and teeth. This is the Snigdha Saragunas that is needed in our body. Then another thing you have to keep in mind is why we are adding this shundi in every places. Which is the dosha that is responsible for the processing, digestions and all these things? Pitta. Which pitta? Pajak pitta. Only Pajak pitta is enough for this. Then which another dosha is necessary? Samana vayu. Samana vayu. So annam grahanadi pachati. So all these are related to samana vayu. So vayu has to be properly maintained, then only this Pajak pitta will act. So whenever you are giving a medicine also, it will be absorbed properly and digested properly means it needs a vayu. So chundi is one of the drugs which is having a snigdha quality. So a ushna with snigdha is one of the important thing in our digestive process. If you take jiraga, if you take dhanyaka, all these are having an ushna with snigdha. Shundi is one of the Kadurasa dravya which is ideal for this ushna with the snigdha, and at the end of the digestion also it will be good. That's why it can roll to correct the samana vayu. And it can able to do a very good conversion of all the things from the Annava Srodasas to the other Dhammas like that. That's why Shundi, Saubhagya Shundi Rasayana, where it is giving in the first, when the delivery is happening this time. So again, that's the aim is to correct the milk productions and all these things and helping the mother's postpartum and anulomanatham, all these things. So these are the important things we have to keep in mind like that. So we go through that. There are plenty of other, I will share the slides if you want, you can go through that. Yes, sir. Yeah. So that will be, it's not here. So there will be that black variety of this yellow has to be selected, good quality of yellow. So 100 gram is there, very good quality of that palm jaggery. If you are getting palm jaggery, that is panapakal, that is the very good one. That has to be scrapped and it will be mixed. So first what you have to do means this yellow has to be triturated. Then you put this gula. Then again you have to mix. Then 100 grams of this shundi has to be added. Shundi powder, fine powder, vastra garida churna, the fiber should not be there. Then again you make a good paste like that and make it into the size as that of an amalaki or like a lemon. So take 1 or 2 bolas daily in the evening hours or any morning also. This will be very good for these things. Nowadays you don't take it from the market because after extracting that what it is remaining, no? With that they are preparing these alundas and coming in the market. So better is if you have that, you prepare yourself by processing like that, and that should be included in this. And such type of yellow is very important in our food also. So the combination of Shundi with this is a very, that's called as in Malayalam Chukkarata the Churnam, like that it is there. So that's double context of this. Any time. No, it's not a problem in the periods. In the periods time also you can correcting the periods, and during the periods time there is no need of stopping that one. You can continue that. Anyone, not only for that, it is one of the important drug. Tila we are forgetting to use nowadays. It's one of the important drug for hairs. It's one of the very good drug for hair. So simply applying will not yield these things. Tila should be included in our foods. Then only it will be. The only thing is, when you are taking the tila, should not take large quantity of the non-vegetarian foods. That is one of the important factor we are taking, because it's Ushna Sthita. Non-vegetarian, most of them are Ushna Sthita. So it may produce more heat on the body. And another thing is, don't mix it with too much of leafy vegetables. That also difficult to digest. So these things we have to keep in mind. Otherwise there will be no problem in taking like that. Okay, next. So another drug is the Rasna. Rasna is the main drug for Vada. So here you can see that Rasna is Ushna, but it is Guru in nature. So when the patients are coming with the pure Vadaja symptoms, this is one of the very good drug you can add, where there will be Ushnatum is needed for Devana Vajanatum, and Gurutum that can pass it. So there are so many controversies and other things are there. Here also, there are so many 2 or 3 drugs which is possessing similar quality as that of Rasna. So what the quality drug you are getting, you can add that one. But this is the one of the good thing, because there will be one synonym called Ela Parni. Rasna is having a shape of the leaves similar to the Ela. So Alpinia is the one plant which is having the shape of the leaves. So this, if you are getting, this is the best thing that we have to use. In South India, everywhere, this is the Rasna we can use it. So how we can use some small kashayas? So usually, we are using so many Rasna, the kashayas in Vadavyadis. So where and when, how to use the Rasnas in particular condition, just we can go through. So we have a Rasna Panchagam, we have a Rasna Saptagam, we have a Rasna Dashamulam. Like that, different drugs are there, yogas are there. When a patient is coming to you with the Sarvanga Vadam and Sandhi Asti, so where there will be so much of disease, symptoms is there, and the patient is telling that I have whole body pain, and the joints are having a pain concentration in multiple joints, you can go with the Rasna Panchagam, where Rasna, Gudiji, Devadari and Shuddhi is there. But a patient is coming to you with a specific symptoms of Janka Uru Prashta Trika Parsha Shulam, a pain from here and Parsha Shulam, and Janka Uru Prashta will be there. Buttocks pain is there, Prashta is there, where you can surely go for this Rasna. So here what the change is, Rasna Amrita escape. See, Amrita escape. And there also Amrita is there. But Devadari is also there. But Eranda is one of the addition. And Punarnama and Gokshura. 2 diuretic drugs. Because below the umbilicus, there will be a chances of swellings are very predominant. Because it's very difficult to get it out to these swellings. So Shodha will be there. Then we need a Mutrala Shodha Haradrege. So these 2 drugs which is having a Punarnava is a Mushna Mutralam and Gokshura is having a Shida Mutralam. Both these drugs as added to this above combination by removing the Shundi and then this will be. So the Rasna Saptakam is one of the drugs which can be acted below the umbilicus where any type. So an osteoarthritic patient is coming, and if you, some of them are having an Achilles pains or all these things, and a radiation like this will be there in Girdrasi like this. So Girdrasi, this is one of the good combination. So if it is too much of Girdrasi problem is there, where there will be a disc prolapse and compression is there, it is not enough. We need more drug which is having a potency of Mutralam and Shodha. So there we will go with the Dashamula combination. So this Rasna Saptakam and Dashamula combination is one of the very good drug that can be used for multiple levels. So already we mentioned that we have kept Amrita like that. And if you have this Rasna Saptakam Kashaya Churnam, and some places also you want to add this, because this Rasna Saptakam I told you, it's mostly acting on the below areas because of this. But you want to give the actions to the upper aspects also, in the thoracic and the cervical area. you can add this with 2 to another drugs. That is, one is Amrita and another is Shundi. So Rasna Saptakam along with the Amrita and Shundi, if you give that Kashaya Guna, then it will be very good for these above also. So all types of pains on these areas, or Rasna Saptakam along with the Dashamula also. So what we are doing means, we will have Rasna Saptakam Kashaya Guna will be there, Amrita Kashaya Guna and Dashamula Kashaya Guna will be there. We will, according to the proportion, usually 120 grams Rasna Saptakam Kashaya Guna will be kept as the base. Then we will add 80 grams of Dashamula Churna. And then we will make a combination. So then ask the patient to know. So 200 grams we will give 9 days package. Kashaya Churna. Nowadays, most of the time we will think that patient will not take this, that, prepare this. Nowadays it's very easy in middle class because induction cooker like things are there. You just keep it. So 2 fists of powder, 5 glasses of water, reduce it to 1.5 glass. And tell them to take, filter it and half cup glass each. Very easy to take like that. So like that, if a base kashayam for a vada is there, along with the small changes you can add with this. So if you want the Rasa Saptakam to act more diuretic, you can add Purana. Already we are in the clinic, we have Purana like that. So like that, Rasa Saptakam is one of them. Another is Rasna Saptakam or Rasna Panchagam with the Dashamul like that. And another good yoga, you have to refer it, I am not included here. Nowadays there will be a multiple problems of this. So many pains on the neck, shoulder, radiations on the hands, cervical spondylitis or lumbar spondylitis or any scoliosis like conditions or any Angamarda back pains like fibromyalgia, all these conditions. Rasna Shundyadivasana. Please refer in the Sahasra Yoga, Jyoradivana. Rasna Shundyadivasana. This is one of the very good kashaya which is having the similar as that of Rasna Saptakam along the combination of Dashamulam with the addition of Shundi, Kadugi. Kadugi will be there on that. Kadugi is one of the important drug in that. And along with that, it is having Sarajara. So that is the combination of that. And again, that this Amrita and Shatavari is coming. So these all drugs will be there on it. That is one of the, so we are not able to diagnose the particular musculoskeletal problem or a particular degenerative thing also you want to reduce, even in arthritis or Amavada, even in chikungunya. After this chikungunya, polyarthritis is a very common. This is one of the very good combination you can give is Rasna Shundyadi Kashaya. So Rasna Shundyadi, now it's available in the market, Rasna, even tablets form also, but Kashaya is the best thing. This polyarthritis with this viral infection, the combination of what we are doing, we have mentioned now, that Ushira, Punarnava and Sanaya. This is simple. This, after giving one course of these types of Kashaya, advise them to take this drink. It's very effective in such type of conditions, viral polyarthritic conditions. So then Maharasana, Devaguna Maharasana. So these also, you go through all these yogas and analyze this. Don't analyze with these gunas or these rasas like that. But you analyze with the Srodha Pratyayavada what Acharya is mentioned. Then you can see that where you have to use this Maharasana. So Devaguna Maharasana is mentioned where in the infertility. So this Rasana is having a very important role in the infertility corrections. So sometimes the patient will come with back pains and other things. We will keep the Rasana containing preparations. After 3 months continuously, 90 days you give these types of kashaya, completely the body will regain its normal and normal conception will take place. So without treating any infertility treatment also. So Vada is one of the important predominant factor in all the infertility problems. So sometimes if you correct this Vada itself, that infertility can get rid of. That's the specialty of our ajaya's of selection of these drugs for particular conditions. That's why this is a Rasana is one of the important drug in all places of our Vada, from the head to the top. Only thing is, you have to look, it is a pure Vadaja, where there will be more Laguna is aggravated and more Shidatva will be there. That such type of conditions we can go for Rasana as well. If it is an Amato is there, it will not work that much. There we have to go with the Amrita like drugs, what we have. Next please. This is one of the important drug, this 2 parnis are there. Prashna Parni, Sangraya Vadakara Divani Vishana. Here also this Sangraya quality is coming. So Amrita also we saw Sangraya quality. Musta also Sangraya. Here also Sangraya quality. Another technique is also there. So there will be Gurdari Gandham Vrishya Sarvadosha Varana. So yesterday you saw one leaf which will be sticked by Sara also stick. So that's the leaf of this. So it will be strictly to your body and it will be close to your organs. So it shows that it is having a Sangrahana. It is one of the very good drug to which organ of our body which is always doing a work? Heart. This is a Hridaya. It's one of the, this Prishnaparni, and that's why it's Vrishya Sarvadosha Sangrahana. So these two drugs, Parni Dvayam is one of the important drugs that will be giving in the first trimester in the of Kshetrabhaga, first 3 months trimester. Kshetrabhaga, this is one that important drug because 2 Hridayas will be starting function. 2 Hridaya. So on that time, there may be a chances of habitual abortion also, there may be a chances of variation in the mind and these things. So in Hridaya Marma, whatever the disease is occurring, a Rasayana drug you can expect is these 2 Parni Dvayas. Even in the Vedas, Parni Kalpa is there, Parni Mandras are there. Because on that time itself, this is one of the important drugs, especially Prashnava. And what the difference between these 2 drugs means, just to that. So, what the difference? You can see that it is a Sandhaniya Gana, Ajaya included in the Sandhaniya. So, in any type of Sandhaniya related to our 3 marmas, main marmas, which are the 3 marmas? Vasti, Hridaya, and so in the Vasti marma and the Hridaya marma, these 2 drugs are very important. In the Vasti marma, what will happen? There will be excessive flows will be there. Sangrahana is needed. In Hridaya also, the proper thala, that there will be proper form of this construction and relaxation is needed. There also Sangrahana. Excessive movement means there will be a Sangrahana problem will be there. So proper Sangrahana, there both the areas this will be there. So then Ankavarda Prashpana, then Valya, it is one of the Valya, and then Shodhakara, and this Nehovaga. So whenever you are doing any Panchakarma procedure, this is one of the important thing we have to keep in mind. Because most of the Panchakarma Dravyas are more Karshanam and these things. So we will add some Upaga to that. Pamanopaga, Virejanopaga. So those drugs which can nullify the problems that created by the normal drug and can add a pharmacological extra action to this. So this is one of the drug which is used as a Snehopaga drug. So most of the Grida preparations for Snehapana, if you process with this, especially for these marmas, this is one of the very good. Why it is so important? You can see that it's Madhura Dittam and the Guru Snittam. Krishna. What will happen here? It is Legu Snittam. So when you combining both these, Madhura Ditta will be very predominant along with the Guru Snittam and Legu Snittam. This is a very rare combinations. Because Snitha will be predominant along with the Guru Snitha is very rare in our classical Dravyas. So this is one of such a combination where the Snitha will be potentiated more along with the Guru and the Lagu, 2 opposite qualities, balance. And then it will be both Madhura and Ushna. So that's why Parni Dvaya is one of the important thing in such type of Arja where there will be too much of Karshanam will be there, there will be body exertions will be there, where there will be more excessive activities will be there. So sometimes we can see that there will be an ECG, there will be such a head will be deep, all these are so much things and variation of this heartbeat and all these things. And sometimes the patient will tell that my heart is beating like that and I am going for something, mental problems like that. If you have these Parni Dvaya in your clinic, you can advise to give that for a Kashayam preparation and control. Or simply with this concept, you go for Pragatyadi Kashayam. Pragatyadi Kashayam is containing this along with the double quantity of Gokshu. So that also will provide some extent about these types of actions. And in Astipagna, that's like Krishnapatni Moola Churna with wheat soup. This is one of the things that we are also practicing in Marma. It's one of the important things. Those Parni Dvayas Churnas will be kept. And this will be put in a bolus. When you are preparing the soups, no, it will be along with that bolus. We will keep like that. And we will advise the Ganji also. So like here that Nabi Marma, below that Nabi Marma, there will be injuries occurring or in Sthanarogita, Sthanamula, injuries occurring. We tell them to prepare the Kashayam with this Parni Dvaya. And then on that Kashaya, rice has to be put. And then Kanji. That rice fuel that can take and along with a little bit of adding the coconut milk also. Such type of soup also, meat soup also can prepare and also this soup also. So this is also, this Parni Dvayam also a very easily drug. So if you go to your areas, in your villages and go for walking, you are observing these things. you just collect these roots and dry it, wash it, then dry it and make it a powder churnam and keep it in a clinic. So for your sustainable clinical use, that is the best thing. You can simply advise some Shira Bhaga to the first times of mother itself. Like that also you can give, there is no need that patient has to come to you and you can do it. You can advise this as a tonic to that. And someone you want to undergo a bone injury, a bone fracture, or a ligamental injury, you can advise this in the form of a Shira Bhaga, or if it is a non-vegetarian, you can tell them to prepare a soup with mutton soup. Mutton is the best thing. So mutton bones are very good for regenerating the bones and ligaments, especially the meniscus and these things. So go with the mutton soups along with these types of things. So these types of simple preparation adaptation is possible. And another thing is, regarding these two plants, very important is collections of the seeds. You know how much cost will be there? 1 kg of this Prishnavarni, Desmodium, Jangeticum seed, 1 kg seed, how much it will be cost? Now in the market, it is more than 7,000 rupees. So, if you start your seed bank here, in your college you are starting a seed bank and collect the seeds like that. If it is 100 gram also, we are ready to purchase because people are looking for that. If someone wants to cultivate a 1 acre land, so many farmers are ready to cultivate. Seeds are not there. It is not possible that we can sell a seed, a plant with 5 rupees or 10 rupees. In 1 acre means how much it will cost. So, but seeds we will give, it will be 100 grams, there are plenty of seeds will be there. So such type of practice also we have to start. This is the thing that Gandhiji is aiming. A sustainable utility, or our Vaidyas also aimed in such type of things. Or all Acharyas are told that utilize your flora at least in your surroundings. Then we can reduce the impact of heavy exploitation of all these things. At least 25% of the local available of herbs you are utilizing, your whole practice and the outlook will change. Because effectiveness will be more, you are knowing about so much new experience, and at the same time you are reducing the over exploitation of these companies or forcing them to give such type of medicines. And another thing is your confidence will arise, your economy will also arise, because you are without giving any money you are taking the plant from the surroundings. But 1 kg if you purchase from some shop, how much it will be then? So this is the way how our Vaidyas are practiced. They will collect this from the locals. No money is needed. Then convert it into a very good formulation. Then that needs a little bit of money. Then it is giving to the patients. So what the amount they are getting, 60 to 70% of the amount is economical to that Vaidya. So how our Ayurveda is sustained till this generation, not only due to these companies. Companies are came within 30 or 40 years producing. So we Ayurvedic doctors should stick on these things, at least 20 to 30% that you have to collect these medicine. You have to use this in your clinics in the form of small formulations and these types of techniques. Then it will be the future of Ayurveda. Otherwise, it will be a very dangerous situation. So this is one of the drug in that asset. Next is another drug, Bela Sangrahiga. Again, Sangrahiga is coming here. You see, Bela Sangrahiga. So this is also one of the good drugs that can do a sangraha. So both these drugs are very important drug which is having a Vada Pitta Hara effect, especially this Bela. So Vada Pitta Hara drug is very less in our classes. Bela is one of the drug which can do such type of things. So here also, after the rainy season, you can get so many Belas will be there in your place also. Do a yajna, that Bela yajna, collect the Bela, when it has to be collected and how it has to be processed is important. Like that, if you, with all this, like that, every day you are going now, this is a very unique thing in, I think, in any Ayurvedic college. These types of studies are not seen. I didn't see anywhere till now. So these types of things with together going and studying in the nature and walking will surely change. It's not about the facilities that make. It's what the commitment you are doing that's make you change. So how it will be modulating your mind, thoughts and your action, even your breath. That's when you go out, you will feel it surely. Your daily practicing like that, absolutely you will feel how your your thoughts and your activities towards the society is changing. That is the basic thing that needed for our life. That's why our Acharya has told that Ahimsa Pranina Prana Vivardhanam. Acharya has told. The basic thing is needed is Ahimsa. How the Ahimsa practice has come? Ahimsa practice only coming through these types of rituals only. So Ahimsa should with the words. Ahimsa with not only with some activities. It should be started from the words and the activities what you are doing. So these types of practices has having a lot of value in modulating and making it a good body. So that you have to practice in the next level when you coming out from the institution. That we can't any principal or anyone can come to you and do all these things. But what the things you have to learn it from here, it has to be developed in your another thing like that what today we saw. A 0.5 to 1 mm seed is developed into such a form, such a big tree. So what the seeds what we are getting here, these types of things we have to get it out in your practice and make it into a big things. So here this is also one of the important things is the Bela. So every doctor start to use this Bela, not only as a medicine, as a tonic you advise in the woman care and in the geriatric care. A simple thing is collect the Bela. When the Bela is maturing, and before the starting of the March itself, it will start to mature. All the fruits will set. The leaves will start to little bit dry off. And then the first rain will come. On that time, you can able to pluck it this. Now if you go and take pluck it, it's very difficult. The half part of the root will be under the ground. But the first rainy season, when you are plucking it out, what will happen is it's very easy to pluck it out. On that time, what will happen is all the seeds will fall down. Next the generation plant will come. That's why it should be collected in flower. Then take that roots, wash it, dry it, and then you start to cut it. You should cut it. Because my guru is told, you collect this Bela and come to that. So on that time we didn't matter. Why you were telling that I have to go and collect this, there are so many other people are there, they can go and collect. But afterwards, after 2 years, when I start to study these things in another ways, and they conveyed that, if you taking like that, you can experience how much difficulty is there. How much Pratitatva is predominant in it. And then you come to and cut it. It's not able to cut it easily. It's very hard in nature. So when you are cutting, it should be what the wooden log you are keeping and then you are cutting now, that wooden log will break it. Within if you 10 kg, if you cut it, one big wooden, that this we are used to cut with that chincha, that is so hard, that will cut off that. Then after that cutting, it has to be chopped into, on that time machines are not there, chopped into small pieces. Then what we have to do? We have to do kutala. It has to be made in this. That is the most difficult thing. If you take one piece of this cutter thing and keep it in this, and then you start kutala, its mass will be increasing. Just like cotton. It will not powder. So what it shows, yesterday we have discussed, which Mahabharata will be there on that? If it is, so that much of Prithvi Agasa Tattva is predominantly there. And if you want, then we will tell, you take 5 grams, 1 karanju from that and weigh it. If you want, we think that it will be, within one place there will be 5 grams will be there. If you put that in that weighing machine and you keep it, 5 grams will not come. 5 grams means this much mass will come. This much mass will be needed. So it shows that much of Agasa Tattva along with the Prithvi is there. And that we are using for various purposes. So if you have such an understanding of this Mahabhuta, you have an experience. So that experience afterwards you will get the knowledge. What is the base scientific thing is inside. And if you go with this last one, 1 or 2 spoons is enough. Because of that Guru Guna. 5 grams will be easily with 1 or 2 spoons. So you can experience a Lagu Gunam and Guru Gunam from very easily. So this is such a Lagu Dravya. Next slide, please. So you can see that it's having a Lagu Snitha quality. So this is one of the very important Lagu Snitha quality. So such a Kvada Churna, if it is there in your clinic, a lady in your family is going to be pregnant and diagnosed as pregnancy, you tell them to take this. Not too much. 1 spoon is enough. 1 teaspoon of this Kvada Churna added with 60 ml of milk. Don't go for the Shirabhagas, what it is mentioned in our classes, but it is nowadays it's too difficult because there are 4 or 5 times taking food to people, and most of them are unpalatable to so many things. So be with this small dose. So 60 ml of milk. Again, you have to add 4 parts of water to that, 240 ml. So total 600 ml, sorry 300 ml, and reduced to 60 ml. Filter it and advised to take on 10 o'clock like that. Daily if you take, then that will be helpful to prevent all types of malnutrition. So nowadays there will be so many folic acid, iron tablet and other tablets, so many things are given. And every 3 months there will be checkup and there will be scanning and all these, but the nutritive things are not getting. What the nutritive things is needed is, mother is needed is, the baby is taking all these things from the bones and these majjas. So the replacement of that nutritive things is possible only through these things. And especially after these 4 months, 6 months, the expansion of the pelvic girdle and all the ligaments and these things now our disc and that ligaments also will expand because the body will be having such a curvature will be more and it's imparting more strain to the thigh muscles, knee joint and downwards. So most of them are suffering with the pedal edemas and knee joint pains. So you have to tell this if you are taking 9 months, it will be led to a good preparatory phase for the delivery. Otherwise, mother will suffer with a lot of problems after delivery. So a preparatory phase to face the difficult situation that is occurring after delivery. So this will give a proper strength and all these things. Even in cesarean also, if the patient is going, with these things are going for a cesarean, then after problems will be get rid of, especially the disc prolapse, knee joint arthritis and all this can be problems. So such a nutritive thing we have to advise to the patients. So this is one thing. Another is in the geriatrics. If you see that there were more than 60-70 years of patients, or so many persons are there in the houses. They want so much of nutritive things, especially there will be insomnia-like problems will be there. Weakness is there. There will be some mental tensions will be there. All are due to pitta and vada involvement. So vada pitta involvement is there. You can advise this Shirabhagam or you just tell that 2 fists of this will be added to the water, that kashaya will be taken and on that rice will be added and then it will be prepared and given. Even in Kerala, after delivery of a cow, this ganji, this rice gruel is feeding to this cow. So for the proper study. So this is the one important drug that other than the medicine, this is one of the very good nutritive things that can be suggested for that. You heard about great PK warriors of Kotak. So has having some simple preparations like that. In the old age time, so one of the thing is this Bela is used to extensively. And another thing is the Dashamula that we are coming, we are discussing. So Bela is having such a qualities. There are so many other problems also that this. Nowadays we discussed about an important problem that is gastritis, acidities. So many things are there in it. Why this is happening? If you take this history of such persons, most of the time they are having a predominance of pitta pragna. And they are having so many mental exertions. So whenever they will having a stress and strain, suddenly the acidity will arise. They will take Jerusalem or something like that. The best is this Nayobayam Kashaya. So there is no need, so many drugs. If you have simple Bela Churnam, you tell them to give 100 grams of Bela Churnam and ask them to take 1 fist of that. Then you ask them to put a half teaspoon of jeeraga and 1 small pinch of this shundi. Don't powder it, just crush it and give it. Then make a kashayam and tell them to take. This Nayobayam Kashayam, it looks very simple, but it's very effective in these various types of acidity-like problems. And if you have Dhanvantara Gulika, this is the ideal Anupana you can give. This by Nayobayam Kashayam with the Dhanvantara Gulika. If you are not having any these things also, you just give Jeeraga Kashayam. Concentrated Jeeraga Kashayam with the Dhanvantara Gulika is also one of the things. Another thing is, if you have Panasa, jackfruit tree in your house, you have to collect the ripened leaves of jackfruit. Then take the petiole, cut the petiole. The combination of jeeraga with this jackfruit petiole, ripened jackfruit petiole, is one of the best for again this acidity. Because that is one of the very good Panasavranda. Panasavranda is one of the very good Kashaya rasa predominant, and it can also act as a sangra. So jeeraga combination with Panasavranda is one of the important again in the Dhanodara Kasha, Dhanodara Guliga. If you see the Guliga, Anubanam in Sahasra Yoga, jeeraga and this Panasavranda is there. So anyway, this is one of the important things. And recently, one patient is chronic about burning sensation. So always he has a weight loss. He's around 60 years of age. After retiring, what will happen means he has always burning sensation, and he will wake up at around 11 and 1 o'clock. So much of burning sensation, and he will drink so much of water, then afterwards the sleep will not come. So no need of Nayabhayam, that simply taking off this Bela Kashaya, simple Bela Kashaya, daily has helped to get rid of this. He consulted so many doctors, he underwent so many scans, nothing else find out. Only thing is, we look at the Sangrahika Vadahara. So Sangrahita, what is happening? There is excess secretions. Endoscopy is found that excessive secretions are coming, and it is producing these things. So the Sangrahita of secretions. The same thing, if your patient is coming to you with excessive lacrimations, excessive twittering of the eyelids, excessive movement of the lips, there also we need Sangrahita. So there these are possible due to a deeper tissue involvements, not a simple these like costa. So we have to go for potentiated Bela with again adding milk and that is Avarti. So where we have to use that Shira Bela Avarti in such type of Indriya predominant like that. So we are coming to that one also. So such type of potentiating is also necessary. So Bela is such type of so there are so many other things also there in Bela. And another thing is Bela Mula Kashayam 1 month, Bahu Vajra Samana, Chakravata it is mentioned. So these things, when you are giving a medicine, Kala is one of the important factors you have to keep in mind. If it is in the Rasa Rekta Dhadus, you can give 21 days medicine is good. But if it is crossed to Mamsa, Meda like that, it's need 41 days medicine. If it is in Asti Majja Dhadu, surely you have to give that medicine for 90 days, 3 months. So like that, this if you are giving 1 month, 30 days like that, it will produce the problems. So this is one of the very good combination in frozen shoulder. Those persons are unable to lift it. If it is too weak and muscle is shrunken, then go with the Rasana and Bela. Only Rasana and Bela, and then make Kashayam and give. So that will be helpful for the lifting of this. So like that, this is one of the important drugs. So that's this one. So there Bela Kashaya Kalkapyam Tailam Shirasavam Pajet Sakasram Shadavaram Vadasram Vadarogam. So in Vadarekta. And this is the most important quotation. Rasayanam idam sreshtam indriya prasadanam. So that's the potentiated 51 avarti or 100. So Jivanam Brahmanam Suryam Shukra Asrit Doshanashanam. Idi Sahasrabhagam Shadabhagam Va Veladailam. So if you are preparing 21 times or 51 times or 100 times like that, 101 is there. That drop 3 or 5 drops along with the Bela Kashayam or the Kashayas what we have mentioned like that, that can promote the deeper tissues involvement, especially in the brain related problems will be there. So likewise, we can use this, and all these Belas Anushtayam are also having similar pharmacological action. Even one thing, this is Mutra Visara, excessive urination. Bela Kashaya is one of the very good things, along with a little bit of Shankara. So nowadays we can see that there are so many incontinence. That is one of the problems now. As an age process, they are unable to hold the urine. So many patients will tell that they are unable to handle diapers and all. So before going for the sleep, ask them to take 51 or 101 avarti of this Shira Bela and apply on the umbilicus, inside the umbilicus, and then go for the bed. So like that, repeatedly, if you continue, we can reduce that. Along with that, if you give these types of Bela Kashaya, so then it will be. So again, Sangrahi. So in Mudra that Sangrahi action can be promoted by this. In cortical, another combination is there, Amrita, Bela, along with Devar. This is used for this Parmaka. excessive urinations. So another important drug is Yashtimadu. Yashtimadu is one of the drugs that can be used as a rasayana. So when we are going for the trial, so many persons are saying and which drug is good for hair like that also. So this is one of the very good drugs that can be used in that because it should be used in the proper form. For one day, only one pinch is enough. Yashtimadu is such a potent drug. So along with a little bit of milk, if you take one pinch of that, that will be very good. So you can see that Chashushyam, Brishyam, Keshyam, Kandyam, Marnyam, Virajanyam. So impart proper color to the body and the body and healing. So this Yashtimadu Churnam will be there. Don't give Yashtimadu in large quantity because it will be coming in Chandi Nigrahanam and same time this drug will coming in Vamana Bhagam. So the dose is the important thing. If you want Vamana, if you give a large quantity. If you give for a small quantity, it will be Chandi Nigrahanam. It will stop the body. So this is the one drug that can be used for such type of. Yes, yes. That we are discussing also. This. Nowadays we are getting this drug, that is the good quality. That's because of the in Afghanistan, Pakistan and from the Kashmir area, we are getting this high altitude plant. This is the Pushkaram. This is one of the important another drug that is necessary for heart and lungs balance. So if this Pushkaramula Churnam is there, you can add with the Dashamula Kashayam or any other respiratory Dashamula Kashayam like that also, or simple Pushkaramula Churnam. That is also along with honey is good for heart and lungs. So whenever there will be Parshva Pida, this is the character feature of heart cardiac pains. This is the gauges. So Pushkaramula is one such drug that we can use for that. That is Hikka, Shwasakasa, Parshva Harana. All these symptoms are related to the heart related problems. Next. That Pushkaramula Churna will be there with honey, it's mentioned in our classes. On other types of Kashara Shwasas like that. Okay. This drug today you know. It's one of the effective drugs for Shwasakasa. So here it is very plenty is there. This also you have to collect it. Very difficult to collect because of this so much of kanda. That much of tejas is there. So with a stick you take like this and then you do like that. You will get the root part. From there you have to pluck it up. This type of solanum has having a very good potent action and it is very good for long-standing COPD conditions. COPD where there will be a balance of this will be there and kapha will be there. More in pneumonia-like condition, this is the best drug. Along with the little jeeraga, you can prepare and take that drug. That will be good for various respiratory conditions. So this is one drug that will be Kasakinam. Has to be used in the nowadays conditions. So now we have to go for some two important ganas that you have to keep in your clinics in the form of Pada Churnam or Churnam. One is this Dashamulam. If you have this Dashamulam, you can use in a multiple level. Because if you see the Dashamulam, Shwasa Haso, Kapha Pitta Nilaham, Amasya Pajanesta, Sarva Vinashanam, Sarva Jara Vinashanam. In all type of inflammatory problems where there will be a jara like feeling is there, then you can go for this. So simple Dashamulam also can be used for various purposes, not only for internal uses, you can use for external dharas also. Dashamula Kashayam can get rid of the pain. So you are not getting the takara, so many drugs for all this and process. If you have this Dashamulam, go for Dashamula Sugoshna Dhara. My teacher, Niranjan sir, is always advising this Dashamula Dhara for the arthritis patients in SD Mudiki. So this is one of the simple technique that you can do. Sugoshna Dhara with Dashamula. If it is Retta involvement is there, Dashamula Shila Bhagavata. So Dashamula Shila Kashaya will be prepared and Rivadarakta like that we can go for this. The same thing you can advise Indian as well. Dashamula Kashaya can be used for various other purposes. Sannivada Jwaram, Shwasakasam, Tandram, Parshashulam like that. Dashamula with Pippali. Dashamula Koda Churnam is there. You can add Pippali along with that. Then Abhipaga, Adinidra, Parshuruk, Shwasakasa like this. So in this Abhipaga, Adinidra, Parshuruk, it's all showing that there will be so much of kapha stagnations will be there. In that we can go over this. Dashamula Kashayam with Shundi in Jwara Adisara, shop up and all this. And next slide, please. So Dashamulam is Duraruba, when Sanivajara also. Dashamula Vrikshadi, like that is Dashamula Baladi. This is one of the very easy problems. Nowadays the patients need this one. Because in diabetes mellitus, in chronic diabetes mellitus, one of the important thing is various arthritic problems. Different types of arthritic problem is there. One of the important thing is this trigger finger or carpal tunnel syndrome. It's very common, and frozen shoulder. These three things are very common in the chronic diabetic mellitus patients. This Dashamula Baladi Kashayam, if you are able to do a Koda Churnam and then you prepare it, it's very good. Especially those who are having a Vada Pitta Prakriti or Pitta related problems, very predominant Prakriti is there, there we can, and even in the neuritis also, neuritic like conditions also, this is a very good. Recently also we have a patient, it's a teacher, she has so much of problems with these neuritis and one hand already bled surgery. It's the same thing happened in the next hand also. But with this Dashamula Baladi, it's worked well, very good. And after 1.5 months, she relieved completely from these symptoms. So this Dashamula combination with Bala is having a lot of action in this diabetic area. Because it's a very good Divana Bhajana property drugs are there in Dashamula along with the proper correction of Aptattva, Shodhahara. And that can be balanced with the Ilya Vadahana Dravya, that is Bala. So that this is also one. And the Dashamula, Peya and Yusha. Like how we are advised this Balana, like that Dashamulam is one of the important things. Here this also one of the extensive even PK Warriors are, and the same time our great Guru Raghavan Tirupatsa extensively used to this Dashamula. Simple Dashamula Kashaya, and inside that you can, if you go wheat you can add. If you want rice, you can add rice and process it. And that will be taken as a food in the night. They will advise for all the old age people. So many complications of this can be get out. So Dashamula is one of the good Gana, Vata Churna form. If you keep, then it will be used externally and for internally purpose. And along with Dashamula, you can make Amruta as a combinations, Shatavari as a combinations. You can add Musta also as a combination in different conditions. You can utilize this. One thing we have missed is the Trinavajamula. Trinavajamula, if you are getting any Kusha, Kasha, Nala, also, that is also a Gana which is having Vada Pitta. So we have plenty of Ganas with Vada Gavara. So Dashamula is one Makada Gavara predominantly. But if you have this also, no need of all these things. If you are getting Kusha, Kasha, these root also, or Ikshu root simply, you make a Vada Churna and give it to it. Along with these Dashamula, you can add, if it is Vada Pitta is there, if you are not getting Bala, you can add this and you can influence it. So like that, most of the drug today we are discussed is related to the Koshtas, Anavas, Vadovigaras, and most of them are in the Vadajar related disorders. One area we are missed is the little bit of Rasayana areas, and another one is related to the blood related problems for the Ekrit and Pliha like that things. So there also you can add some other drugs and you can find out in our classes. And some other drugs also they are more potent than this, Gugulu, then Leshuna, then Hingu. These are also having more potency in the Vadajar. Next one. This is one of the simple thing. Now itself you are in the Dashamula, when you are completing your course, you have to start. No problem, that is. But now itself, in your house, these at least 300 grams powder, don't purchase from anywhere. You purchase 100 gram Haridaki, 100 gram Amalaki, and 100 gram Vidaki in the form of. When you are purchasing in the drop off, don't go for this purchasing method. When you are going for a removed husk of that seeds and you are getting the drug in that form of that, then you can go with this 100 or in the form of churna. But if it is you are purchasing the whole fruit like that, you have to think that is one is Dvikarsha, another is one Karsha, then another is a Koalapala. So there will be variation in that. That is why there will be a ratio is correct. So if you are taking one Haridaki, you have to take two Vividaki and one Hamalaki. So that's why that ratio, that's a whole fruit. Then you have to dry it and remove the seed and then you make powder. So So nowadays you can get from the market that removed seeds, removed that thing. That you can take 100 grams each. That will be made into a powder, fine powder. Vastra Garya Churnam, and keep it in your house. All of them are suffering with various eye problems. All of them are suffering with various skin problems, various hair problems, especially dandruff. You just use it. You people only use it. One day you take a little bit of this churna, 1 spoon of churna, mix it with a little bit of water. Then when you are going for a head bath, apply it and then wash it back. You can feel the coolness and how it is. How it is a very good kapha pitta gara. And it is very good for dandruff. So first 7 days continuously you use this. Then alternately weeks 1 or 2 days you can use. And this can be used for daras also. The triphala can be used for allergic these problems. So many children are nowadays having dandruff like powders in this. They are having irritations and continuous itchings. There will be discoloration of these areas. This dara is very good. And another thing is, if triphala is there, you can go for gargling. Triphala gargling. Another thing is, many types of itching or any problems related to the genital organs, is it male or female also. This is very simple way. You can use as a sit bath or you can wash this. If it is a white discharge more and there will be an infection will happen. If it's a candidiasis, there will be an inflammation will occur. This will be one of the good things that we can use. Even this can be used as a bath powder. As Musta we are told now, like that this also the Haridaki specially. Haridaki specially it is very good for those who are very stout and they need to get rid of these things and bad odor from the body. Simple Haridaki churna mixed with the Shankar Churnam is the reference in Vaishidharanavi. Shankar Churna mixer is there. And even in dandruff, if there will be too much of crusting is there, mix this triphala churna with Govandi Basma. 100 grams of this triphala churna, 1 teaspoon, 5 grams of Govandi Basma mixed together, and then you mix this, then it will be very soothing and it will remove the scales of that. So like that, triphala is one of the things that has to keep in mind in this stomatitis, even in washing the ulcers also. So keep this in your house, it surely will work for a lot of things like this. And if you separately look just like this, if you separately look, you can see that there will be so much of indications in different form. Here we have to take is Meha Kushta Vinashini, Chashushya Dibani Chaiva, Vishamajwara Nashini. So triphala will coming in which ganas? Main gana in Charaga, Mahakashaya, no? Triphala will come in which areas? Ushtagna. Then another area is Jwaragna. It's coming in Jwaragna. So when it has to be used? An epidemic is occurring like that what it is happening here. You have to advise the people to take this triphala continuously. Even a small triphala kashaya has to be taken daily. Then it will help to get rid of this jwara. So any type of Vishama jwara is there. There we have to give this. So triphala is one of the very cheap medicine. So whenever you are seeing that in some villages or some places, there will be so much of such type of epidemics is fastly spreading. You advise them to take this triphala. Otherwise, Susruta told a technique that is Haridaki Churnam has to be taken and double quantity of Buddha has to be added, and that will be continuously if you take also, it can keep away. So why you want to increase your immunity and all these things, triphala is the one of the. So don't wait for a jwara to come and then you take such drugs. If you correct it with this, then it will be so because it will help to get rid of the unwanted malas of that. And the triphala rasayam, you know, it has to be taken along with the honey and ghee on the night. Yes, ice not only for ice, all this on there also you have to keep in mind means the quantity of honey and ghee. It should not be equal. So if it is a little bit of ghee will be ready, then honey has to be increased like that. And Susruta is again mentioning is Sarvajara Bhagam. It is very good for Sarvajara. So where there will be a long-standing fever is there, we have to advise this triphala as the main ingredient. So there will be urinary bladder infection, cystitis. Continuous cystitis is there, and there will be concentration of the bacteria will be always high. Triphala kashayam or Balatrigadi like kashayam is one of the very effective things. Even there will be a viral load in the hepatitis like conditions. There also we are giving this Palatrikadi Kashayam like that. Why it is affecting means because of this Triphala. So Vara, it's a very important thing is this Triphala is one of the Sreshta Aushadas like that. It can having a lot of activity in almost all the things in our body because all these three things together has having a very predominant rasas, all the rasas and all Mahabhutas that can easily balance the all three doshas inside our body. So this is one of the very good important rasayana that we can use for various eye and all these things. So Triphala is one of the important things that you have to keep in mind, and if it is possible, in near to your place you have plenty of places are there, grow these three trees. And then observe that how it will be growing, how the nature will be, and then how it will be fruiting and all these things. Then you collect that fruit and use for various purposes also. It's very good for studying and understanding, and it will be preserving the nature for the next generations. So the three trees that will be important in your life is these three trees. Three small herbs that will be used very important in your daily life is, one is ginger, another is pepper, and another is pippal. So these three drugs. Another three climbers that is very important is, one is Gudiji, another is the Sariva, and another one is Gudiji, Sariva, and another one is Shadavali. So one of the important drugs that we have to keep in mind, because that type of rasayana will be there. And some of the grass that is very essential is, one is the Musta, and another is Kushakasha like that. So all these drugs are very important to us. So some grass, some herbs, some shrubs, some climbers and some trees, if you are able to preserve and you will make a clinic, a model clinic with all these medicinal garden, the patients automatically come to you, flowing to you, and you can start these types of practices. That will make you a unique Vaidya to the future generations to come. So for these purposes, along with that, we have to do the researches also. So along with that, we don't, Acharyas have never stopped these AGROUSHADA's findings. If you see the traditional books, like if it is in the Karnataka or if it is in Tamil Nadu or in Kerala also, they are always search for new AGROUSHADAs also. It's our duty also to find out new AGROUSHADA that will be effective for a particular disease. This is one of the fern that is used in Tamil Nadu and in Kerala also. And so in Karnataka also it is using in certain parts. It's a very good for knee joint and back areas, disc and joint problems, arthritis. It's an edible one. It's called as artukar. Artukar means it's look like a god's leg. And it is soup is given in Tamil Nadu for drinking purpose. So we can also find out this rhinorrhea coccipodia. So now our senior madam has done this study on the osteoarthritis under virus. It shows a very good action on this osteoarthritis. Chinese people are using very extensively. So this will be one of the very good drug for our Vada properties, especially related to Sandhi. Like that, plenty of new drugs also we can find out like that. Like that one drug today we saw is Otelia or Karalama like that. And another rare plant we saw is today is, all of them please observe these plants. These three plants are very rare plants we have observed. One with that paper will be there. So, So this is one of the plant which is having a growth in such a form between the rocks, and in so much of drought season also it is growing, and whenever it is exposed the gods will come and eat it. So if you eat this one, you will forget about if you eat in a good quantity, at least 12 gram if you eat, you will forget about your appetite and you will not feel that things, but energy will be maintained. It's called as Karaluma. And this is used for conversion of so many heavy metals to these also. And another drug what you are seeing is, this is a climber. And this is having a potato-like tuber will be there. So this is one of the variety of soma. Another variety of soma also you already see when you are walking. So all the somas, Susruta Acharya are telling about 18 varieties of somas. But a common feature Acharya is telling, all the tubers, all the plants soma is having a tuber. And it is having leaves that will be fall down and again it will grow. So that depending upon the moon movement. And when you puncture any part of the leaves, it will yield meadows, however. a sticky exhalation which will be translucent and watery in nature. All these plants will possess this. So in Kandavat, then Patra will be going, coming and coming back, then a Medo Saravat. And Vijitra Kusumas, if you observe this plant, flowers, it is having a numerous various types of these flowers, character feature. So these types of plants also there, which is having very potent, but it is rare. It's our duty to preserve these plants in the natural habitat and then reproduce it, and it can be used for the future generations of crop. These are very rare, very fortunate, and we are very lucky with the blessing of all the peoples we are able to find out this plant. Maybe this may be a rare endemic plant of this particular area, and we searched with a little bit of time. I searched in the floras. In the floras from this Chitradurga district, this type of plant is not reported. I didn't find that. Maybe a possibility of a new Sarapegia species or a Sarapegia which is very rare. So such type of plants will be there. So be careful with this and see that when the fruiting will be there, you can take the seeds and do the sowing and multiply it, then it is very good for the conservation of the practice. So that is also one of the duty of ours, to preserve some of the extinct and rare plants like that, and Somavali also. And some of them are local to this area. You can start a cultivation of Somavali, because this is one of the very ideal place for Somavali growing. And in all parts of India, people are waiting for this Somavali, because it is one of the main ingredients in Manasamitra Gurya. So for Pavana, it is a very important drug for mental activities. Somavali Adhikrita is also there. So that like that. So always do studies and do start to experience these things. So that two things you are going to keep in mind is, one of the important in knowledge is Vijnana Aushadhinam, knowledge about the medicines. The second thing is Yoga Vaidya Gunana, the knowledge about the combinations, where and how to apply and how to combine this. This will make a very good Vaidya. And one thing you have to keep in mind is, Charagajara is telling that, what is the Vyadhiharam Uttamam, which is the thing you have to do when you are making a formulations or when you are making a prescription or when you want to care these patients. Vada Pitta Kapharam Cha Yatyade Prashmane Kritam Pradhanyada Nandishtam Yat Vyadhiharam Uttamam. Two things you are to keep in mind. One is Dosha Patyane Chikitsa. That is Vada Pitta Kapha balance. Then this is Pradhanyada Nandishtam Prashmane Kritam, means the drugs which is what you are seeing now. So if you are combining these AGROUSHADA along with the Dosha Pratyanika Dravyas, there are two sets of Dravyas. One is Dosha Pratyanika Dravya and another is Vyadhi Pratyanika Dravya. So Vyadhi Pratyanika Dravyas, what you are seeing is that all of them are very potent AGROUSHADAs. Till now what we see, some of them. There are some other drugs also there. So this Vyadhi Pratyanika Dravyas of AGROUSHADA, if you combine with the Dosha Pratyanika Dravya, that is the treatment. So Amardotram Kashayam you saw now, that is the Vyadhi Pratyanika Dravya is Amrita. The other two things are the Dosha Pratyanika capitals. So when you are combining this Amardotram, that Amrita with these Dosha Vyadhi Pratyanikam and the Dosha Pratyanika Dravya, that will be an ideal formulations like that. So if you keep like that, any patient is coming, you look for the Dosha Visheshan, which Dosha is mentioned and which Srodhas is involved. Depending upon that, if you select the medicines and give, the treatments will get a result. Surely it will give. There is no need of the naming of the disease or knowing about so many things of the other disease also. If you see that in modern pathological books, there are so many unetiological things, idiopathic causes. In that also there will be no treatment and no medicine. So we have to treat the patients with other systems also. So our Ayurveda is giving such a scope, means you have to look in which dosha is involved. So if a patient is having too much of shivering like that, Parkinsonism or like they will diagnose as Parkinsonism. Most of the 80% is not at all Parkinsonism. Any shivering they will start to give these Parkinsonism medicines. And the whole life they are taking that. After that they will become just a dead body is like that, simply sitting and doing like that. That is the medicine they are promoting. We should know about the things. Nobody is talking about such type of things what it is happening there. But in that shiverings, the starting level itself, we are used to a Vyadhi Pratyanika Dravya like Bala, along with the combination of which dosha is aggravated on that patient, and if at least the patient take 1 or 2 years, then it may subside, it will not progress at all. But the whole lifetime the medications will be there, even in the Avasmanas. You can see that phenobarbital-like drugs are giving in the whole lifetime. Diazepams are completely giving in the lifetimes. So these things nobody will speak in the public. Why means the pharma companies or other people are afraid about it. Someone has to speak. So it's a duty of our thing also. There should be an ethics in the medical field. So we have to highlight what the things are going on. Not only in the medical field of modern or other things. We have to criticize our Ayurvedic medical field also. Because we are also doing so many unwanted things in our practices. That also we have to nullify. So these are all are the duties of our young Vaidyas to do and look into these things, and you make articles, you make talks or you make videos. There are plenty of scopes are there nowadays. You can reach anywhere and to give the public a very good idea regarding this. Otherwise what will happen? Some other big peoples will occupy these places. Now what is happening means the people will study a little bit from there, and they will come to this YouTube and all these things and telling that this is the thing is happening, this is the thing is happening, and this will be good for their purpose and all these things. And they are delivering it in another way. It will be harmful to our science also. So these are also very important in our activities. So thanking took out a lot of time of you, and thanking all of you for patient hearing and listening on that. Maybe there are so many points maybe missed on that, and I am not able to include it and all these things. You can look into these aspects in these manners things, and then you read that. You will get so many other inputs what I didn't get here. So once again, thanking the principal sir and my dear friends, teachers. All the students and all these things. Yesterday, the first year students, I felt so people think that they felt a little bit of discrimination because they are just ended. So they are unable to follow that. But surely it will benefit in the future. When you come to the future studies, it will be surely benefit in another ways. Now you can't able to know about that depth of that. So just observe that experience also will benefit you in the future. Anyway, with a lot of mindfulness I am going from here, because a survey is on the field and then the class. This is not happening anywhere. We will be conducting these things. But what the environment created here, it's a very good thing, and it's a blessing from my gurus and all of you, thanking all of you.
So if you have time, please go through all these things. So what are the plans collected is now all kept here. And if you want any doubts or something has to be discussed there and also that also can be discussed. No problem. I can discuss that one. If anyone interested and if you want to ask something, among this. Because again, this is also one of the layers. And that's why I want to take photos of this. Whenever
we will go for the studies in the field. On there, they will all will show some eagerness and all these things. But afterwards, all the collected things will be dispersed anywhere on the way itself. But here it's I found that it's all the things are displayed, and I also astonished. I also astonished that there is more than 50 drugs is there here. So this much drugs we have discussed that is that also one of the important things. So my humble request is all of them you have shown, especially so many persons are shown interested. You have to make a field note and write an article. So if you give a good article regarding these things, we will publish it. Or we have also a journal is there, or otherwise in other journal. Ethno medical surveys of that what you are known as Sandur forest, ethno, especially today's this area. So around the campus, that particular area, how the geography and that particular importance and what are the rare plants. So if anything is there, I also supply the things to you. So we can make a good article and publish this much rareness and endemicity will be there. And you keep all these plants there in your garden, the places, and you go with this umbilical. You just to do that collections and then. And another thing you forget is that saltifying, Cocculus hirsutus. You have to see how the water will be become solid, saltified or that. So such type of things also you have to do. So this will be a very good asset, and this is a very nice thing what you have done. Again, it's thanking all of you.
If anybody are having questions to ask. Thank you, sir. It was very informative and letting us know the importance of plants in Vaidya's life. Now, I request our dedicated importance of DRAVYA GUNA also. I request our dignitaries to facilitate our chief guest, Dr. AJAYAN SIR. ಹೋಮದ ಸುಮಗಳ ಕತ್ತನ್ನು ಕೊಯ್ದು ಕಗ್ಗಲ್ಲಿನ ಕಗ್ಗತ್ತನೆ ಕೊಯ್ದು ಗಿಡೆಯು ಕಲ್ಲಿಗೆ ಬಲಿ ಕೊಡದಿದ್ದರೆ ಪರಮಾತ್ಮನಿಗೆ ತೃಪ್ತಿಯೂ ಇಲ್ಲೇನು. ಈ ಗಿಡಗಳು ರಾರಾಜಿಸುತ್ತಿದ್ದರೆ ಶಿವ ಪೂಜೆಯು ಸಲ್ಲುವುದಿಲ್ಲೇನು. ಸೌಂದರ್ಯ ಸುಮ ನಯನವಾಗಿದ್ದರೆ ಶಿವ ಮುಖ ಚಂದ್ರಕ್ಕೆ ಚೆಲುವುದು ಸತ್ತರೆ ಭುವನಕ್ಕೆ ಮಂಗಳವಾದಿತೆ. ಬಿಡು ಅದರಲ್ಲಿ ಆಹು ನೀ ಸೃಷ್ಟಿಸಲಿದ್ದರೆ ಚೆಲುವಿಗೆ ನಿನ್ನಿಂದೇಟಕ್ಕೆ ಸಾವು ಬೈಕುವರು. Now I request our beloved principal sir to talk a few words about DRAVYA SAMIKSHA 2.0.
Shri Gurubhyo Namaha. Ayurveda Amritana. Yesterday, those who came to Sandur for observing the identification of medicinal plants with AJAYAN SIR, all are very lucky fellows. And those who are there in this today morning, they are still more lucky fellows. And I can't say everybody is unlucky, because the rest of them today they are here, they are also lucky. Only lucky fellows can enter this Bapuji Ayurveda Medical College. The reason is this: if you come and see here, more than, as Sir said, more than 50 medicinal plants, that too rare plants are there here. Last time when I myself also gone with him, I really got surprised to see such medicinal plants in this dry area. Generally people have a kind of aversion towards the dry area. There is nothing, enthusiastic things are not there, living things are not there, such feelings will be there. But today also really we got, last time we got astonished to see the one plant, Soma plant. This time again, Sir was telling about there are very extinct plants that too just behind that Jagaraja temple, and that are very miraculous plants and very rare plants. And Sir was saying one more thing. In Kerala, some foreign people are funding to just save the medicinal plants. They are spending 2 crores rupees per year just to save those medicinal plants. Such things are happening, but we are in this field of Ayurveda, we don't know about these things. And we are, most of the time we are living in a kind of darkness or kind of enthusiasm which is of not having a meaning. Such a way we are spending our time. So let us take this hope and inspiration with this explanation. There was so much to tell, but there is a shortage of time. I was observing, just you are so much accustomed to daily routine. Once a 5 o'clock is over, in spite of any situation, there is a hydrochloric acid dribbling into your stomach, and you just change the positions. So that is what is happening. I think by seeing that, he stopped saying things. Some boys were like traveling there itself. So that made. So whatever Sir has given very great ideas, and so many other ideas also we were discussing. He has not mentioned it. That is about home garden and kitchen garden. This is again a great concept. Just with the surrounding of our homes, what medicinal plants we can grow and we can use for day-to-day life. And also the kitchen garden, nowadays it is a little popular one. This is what he was saying. And also, another point he has mentioned about the seed bank. There are many plants available here, we can collect the seeds. Instead of spending our time in a wasteful way, we can make it useful and meaningful, and it should add value to our life. So that way to spend our life, we can collect these seeds which are available this in and around Chalkere area. As now the DRAVYA GUNA department responsibility is increased, and Sir has given us a thought that these fellows can be viewed in this way, and they can collect the rare medicinal plant seeds. So that definitely going to become useful to the college and to the society. And another important thing he has mentioned, the cultivation of medicinal plants and growing of medicinal plants and marketing of medicinal plants. He is suggesting us to start a certificate course at our college, and just to think and finalize with Sir, and you all of you can make use of it. And another one more thing is about Marma Chikitsa, that also certificate course we are planning. So you can join to that course, and you well versed in Ayurveda, and in future go with a confidence with all kind of Ayurveda treatments. So this is what is our intention. There is no business here. Don't let your sometimes dirty mind work in that way. We are not up to that. And this is what just we want to give a knowledge, a proper knowledge, and all of you should go with a confidence. You should go from our campus with a confidence, not bending your head down. You have to raise your head up and you have to live in the society in a high professional way, highly professional way, and of course, whatever the knowledge you get, the Ashtanga Hridaya Sangra, the shloka is there. ಅದಕ್ಕೆ ನಿಮಗೆ ಚಾನ್ಸ್ ಕೊಡ್ತೀನಿ ಅಂತ ಹೇಳಿದ್ರೆ ಮಾತಾಡಿ you are getting a spark from my dialogue and then you will continue and later I will conclude.
For that I request our principal to arrange some more guest classes.
That is not concluded. Kochit Dharma, Kochit Tisha, Kochit Maitri, this all is there and I definitely will get the success. And this is a beginning. Inviting Ajayan sir to our campus is a beginning. In future time, he is going to become one of our regular resource person to our campus. I wholeheartedly welcome him. As and when he comes to Karnataka, let him come to our college. And that is what is our request. Such a overflowing knowledge he is giving. And students are overflowed. That is the problem. We have a sufficient time. We make like a workshop in future so that we will do this still more modified way so that everybody can gain the knowledge. So that is what is our intention. Definitely this DRAVYA GUNA SAMIKSHA 2.0. Okay, 2.0, it made a very great meaning. It added so much value. So all the students directly involved, indirectly involved, and all the teachers who are directly involved and indirectly involved, all got benefited with this particular Samiksha. And definitely in future we welcome you sir to visit our campus. We will make this campus still more colorful way with all the different types of medicinal plants, and let all the students carry this knowledge and make use of this at your hometown and at your homes, and make your parents so much respectful. They should also feel so much happy by sending you here to learn this knowledge, and always be with the confidence, live with the confidence, live with the spirit, live with the enthusiastic way. Don't spend your time with just mobiles. All the knowledge you gain, and the greatest of our responsibility is that you are saying about extinction of the plants. We don't get that plant. If the plant is get spoiled and vanished, you can't expect those plants in future. Future generation is not going to see those plants. See, this is now our responsibility to rescue or to maintain that plants so that we can increase the number of plants and we will make it abundant and next future generation make use of all those things. This is what is the idea. Definitely we take this inspiration and let all of you take this responsibility of maintaining these medicinal plants. That is definitely we will do. And thank you very much, sir, for giving us knowledge and inspiration. And I thank you, Professor Videla. Okay. And I thank Dr. Nirbhadra Gowda and Dr. Niranjan. They have taken so much time. And all the second year Alpasankhyaata branch. Did a great job with the full inspiration, and especially our Vishna, he took so much pain to communicate and coordinate so many things, and all other students those have ignored. So that will become a note of thanks. Again, I request Ajayan sir. See, imagine if the knowledge is there, that flows like a river. And even experience his knowledge, it was flowing like a river. It is your capacity to receive and store. So he was without tiredness, more than 3 hours continuously he was sharing his experience. Time is not enough for him. So let us take another opportunity to gain more knowledge from him. Thank you.
Good evening, everyone. It's an honor to deliver a vote of thanks for this memorable occasion, DRAVYA SAMIKSHA 2.0. Firstly, I extend my heartfelt gratitude to our esteemed guest, Dr. AJAYAN Sir, for his insight and inspiration session that enriched us all. My sincere thanks to our principal, Dr. Basavarajappa Sir, for his consent, support and guidance which made this event a success. A special thanks to our Dean Sir, Dr. Lakshmi Narayan Sir, for his encouragement and thoughtful insights. I also express my gratitude to our DRAVYA GUNA lecturers, Dr. Niranjan Sir and Dr. Veerabhadra Sir. I am grateful to all other lecturers who graced this event with their presence and valuable input. A special mention goes to our senior students for their active involvement and guidance, and to our junior students for their enthusiastic participation. Our AGROUSHADA batch has truly excelled in organizing and participating in this event with remarkable dedication and a dream work, setting a standard of excellence for others to follow. Lastly, I think all the participants and attendees for their enthusiasm and engagement, making this event truly memorable. Let us carry forward the knowledge and inspiration gained here into our future endeavors. Thank you and have a great evening.
Now, on behalf of AGROUSHADA, I thank all the dignitaries for creating a great opportunity for us to know about the drugs and clinical importance.